session now. Okay, that's great. Good afternoon, members, we're just waiting for a couple of other members to start, but we are now in open session for today's meeting of the Education Committee. I would advise members that the committee meeting will be recorded and broadcast throughout Parliament buildings and online, and I would advise anyone in the public gallery that they're welcome to use mobile devices as long as they're in airplane mode and that all devices are muted. And I'll just emphasise it's not permitted to take photographs or record any part of the meeting. So we'll move to item 1, which is apologies. We have no apologies today. I think I have an apology for lateness from Michelle, but no formal apologies for the meeting. And we do have both Colin and Kathy joining remotely. And for anyone joining remotely, any issues with audio or with indications coming through, please do let me know. And if I could just ask to use the raise hand function if that's possible to indicate to make sure we do see you when you're looking to come in. Item 2 is chairperson's business. So I'm going to just, there is item 2.1, there is a report from the informal meeting that was held with the Children's Law Centre on the 25th of March. I'm just going to propose I bring that into matters arising, where we also have some correspondence tabled from the department in relation to the Royal College of Nursing along the same, in relation to the same issues that the Children's Law Centre briefed us on in relation to restraint and seclusion. So we'll pick that up at item 4. Item 2.2, which has just been tabled quite recently, so in case members haven't seen it, I would just draw their attention to tabled papers. There's a letter came through from the Ulster Teachers Union, which was inviting me in my role as chair to come and speak at their conference next Friday. So just wanted to put that out to members if members are content that I accept that invitation. And I would probably just caveat it, and hopefully members will understand and give me a bit of latitude in this. It can be difficult to wear two hats at this event, so if members are content, I would obviously ensure that any initial remarks are made in the basis of my role as committee chair to ensure that the committee's views on the major issues in education and our priorities are reflected. But if members are content that I make some remarks in my own capacity as a private member, that would be appreciated. But if there are any views on that, happy to hear them. But if members are content to agree that.
Yeah, sure. In the best constituency as well.
Absolutely, yeah. I'm heading out to
East Derry.
East Derry, of course. No, that's great. So we'll, if we can go back to the UTU on that basis, then. Just item 2.3, there are no tabled papers on this, but the clerk has circulated this by email again, as it came in very, very late. But we did get an email from Young Enterprise, who the committee has engaged with extensively, advising that they are meeting with the junior ministers next Monday to discuss how the executive can support their work. It's something that the committee's been very supportive of, so I just wanted to put on record at this stage of the meeting that we're really great. I would say we would hopefully all endorse the view that we're grateful that the executive are engaging with that at the executive office level, and we would certainly endorse anything at all that the executive office can do to support the work of Young Enterprise. Hopefully all members will concur with that. And then the final item, just in chairperson's business, this may have been picked up last week, but I raised it with the staff from Bangor Academy in the room. It possibly was slightly unusual context, so I would just think it would be important, if it hasn't already gone, that a formal letter of thanks from the committee go to Bangor Academy just to thank them for their hospitality and for their time in terms of the tour, which I think was really, really positive to see the very, very progressive approach that they take to SEND provision and for letting us use their hall. So I'm not sure if that has gone already, but if it hasn't, if communication can go to the school, if members are agreed.
Agreed.
Okay, that takes us to item 3 then, which is declarations of interest. I have none to register. Do any members have any interest to declare in terms of items on the agenda today? No, that's fine. If anything should arise, as normal, please do indicate so that note of that can be taken. Item 4 is matters arising. So first of all, and we'll deal with this briefly, we have notes from the tables taken at the committee's event on outdoor education, and that's at pages 11 through to 26. There is just a little bit of work being organised to bring the live artwork that was done at that event on, which I think all members responded to very positively. positively on the day, just to reflect back those table discussions. And I think in due course, over the next number of weeks, we'll get an item tabled for a fuller discussion around any outworkings from that event. And there was some suggestion about committee interest in a motion, so perhaps a draft motion could come forward for the committee to consider if that's something they wanted to take forward. Are we all agreed?
Right.
We then have, as I mentioned earlier, the other item in matters arising. We have correspondence at page 28 from the department, and that's concerning the department's work on restraint and seclusion and the task and finish group, but specifically picking up some of the discussions held at committee last week around the Royal College of Nursing's decision to leave the task and finish group. And so D have written offering engagement with the committee on the issue. Now, it's not completely clear to me from the letter whether they are saying they are in a position to offer a formal briefing at this stage, so we can perhaps pick that up. But to maybe just track back to the Children's Law Centre briefing, they also highlighted a range of issues about the task and finish group. They were still very clear that their intention currently was to continue participating in that group, as they want to be able to bring some influence to bear. But the main issues that they highlighted, and if members want to add anything else that I might have missed, was a concern that the guidance for health and education could potentially end up not aligning, and there was some concern around how that would operate, and some concerns around the potential around human rights compliance, particularly while Article 41C of the Education Order 98, I think it is still on the statute books, which permits the use of force in schools to maintain good order. We also have the RCN's decision. So I would want to sort of suggest at this stage that we do go back to the department to respond positively in terms of engagement, but I would be perhaps happy to maybe through the clerk establish with the department, are they going to be able to come and give a formal briefing that will be substantive? The last time they briefed us on restraint and seclusion, it was essentially a briefing to say they couldn't brief us. So I think if they're coming for a formal briefing, we want to know that they would have substantive material to bring. If they are of the view that an informal briefing, and indeed given our forward work plan constraints, if an informal briefing is deemed more appropriate, are members happy to delegate that to the clerk to find the most appropriate mechanism?
For now, it is an informal briefing that they're offering.
They are offering an informal briefing.
Yeah.
Okay. Well, I think in the interest of time, I would be of a mind to take that offer up at this stage. But if members are agreed, or if there are any other views, no, great. That's fine. So that moves us on to item 5 on the agenda then, and that's draft minutes, and that is of our committee meeting from the 26th of March. That's at page 31 of your packs. Are members agreed that that is a complete and accurate record of proceedings? Agreed? Sign these. At the back, is it? Yeah, here we are. Thank you. So, item 6 then, this is our first briefing of today's session, and it is from the Education Authority, and if the clerk's team could just bring the witnesses through. So I'd refer members to a briefing note from the committee clerk at page 40, a briefing paper from the Education Authority at page 41, and a report also from the Republic of Ireland Post-School Transitions of Students report at page 46, and a report on disabled students' school and post-school careers at page 219. So as the witnesses are just coming through, this will be a briefing from the Education Authority in relation to their transition service, specifically for students aged 14 and over, to prepare them for their transition out of the statutory education system, and particularly looking forward to the post-19 transition process. So joining us today, we have Claire McKenna, Head of Statutory Assessment and Review Service from the Education Authority, and Elaine Craig, the Interim Assistant Director for SEND Statutory Support Services, also at the EA. So you're both very welcome here today, and thank you for your time. We, as always, have a big agenda, so I'm not going to really go through much of a preamble here, other than to hand over to yourselves for any initial presentation or opening remarks. I would ask that be up to 10 minutes, and then we will move to question and answer from members, and we try to keep that to 5 minutes per member where possible. But over to yourselves at this stage.
Okay, thank you, Chair. Just at the outset, do want to say that Claire has recently taken up a new post as Interim Assistant Director for Special Schools. So this is day 3 for her, but important that she's here for this because her substantive role is with the Statutory Assessment and Review Service. So thank you for the opportunity, Committee, today. The Transition Service is part of the Statutory Assessment and Review Service under the division of SEN Statutory Services within Children and Young People Services Directorate and EA. Our Transition Service is a small team with a team lead and with 10 transitions coordinators that are aligned to each of the Health and Social Care Trust areas. And all children then who are 14 plus, so in year 10, should have a transitions plan in place. Now, Claire's going to take you through the statutory duties, the role of the coordinator within that, and what the plan should entail, and then some of the challenges then that we face. And we know that, conscious that you heard last week in terms of Caleb's calls, so we know that you'll be familiar with some of those from a parent's perspective.
Thank you. So the transition planning process is a statutory duty set out in legislation, and that was the 2005 order amending the 1996 education order, and then further detail is set out within regulations and the code of practice, and the guidance really around that transition process for statements is set out quite clearly and directly within the code of practice on the identification and assessment of special educational needs, and within the supplement to the code which was issued in 2005. So schools and the Education Authority have a key role in managing this transition process. The Education Authority's Transition Service was set up in and around 2006 after that 2005 order to help young people and their parents and carers access appropriate information, guidance and support to help them make informed choices about the future. So the service is really about signposting to appropriate support to the opportunities and pathways that are out there. So it's important to have the up-to-date information around all of the opportunities that are out there for our young people from 14. So for all pupils with a statement of special educational needs at 14 plus, that's why it's called the 14 plus service, transition service. So that really begins in year 10 of the child's educational journey. It provides support to schools and works to promote pupil and parent and carer participation in the transition planning process, and working closely with the Careers Service under the Department for the Economy and other statutory and voluntary agencies. So just to highlight the numbers and the data, at the time of establishing the Transition Service, there were 3,282 young people in transition, and that was from year 10 up until the age of 19. As of March 2025, there are approximately 9,000 young people in transition. So when you look at our team, we have 10 within the service, and that has been, over the last few years, we've had difficulties with recruitment and sickness and stress as well. So we've had a depleted number within that team. We're more or less at complement now with one person still to recruit. So that's a caseload of about 800, 880, I think it was, each there, with the 10, but more with the reduced service. So the role of that transitions coordinator. So what they will do is support the young person and their family, guardian and carer through that transition planning process. So that first transition meeting in year 10 is crucial in terms of introducing the service, what they do and what their role is, meeting the young person and meeting their parents or carers. They advocate for the young person, they liaise with and support schools in the implementation of the transition plans. So there's training with schools on how to prepare that transition plan. They collaborate with the various statutory and voluntary agencies and strive to overcome any obstacles prohibiting effective or smooth transition. They flag important dates, they will attend key events and make that available to parents as well, make sure that parents and carers are aware of anything that's happening in that space. Open days, events at FE and further education. So ensuring that the necessary information and impartial advice is available to assist in making educated decisions. So it's really supporting that parent to make decisions about where their young person should go, and the young person as well, what their views and aspirations are. And they will, the transitions coordinators...
Sorry about that.
It's okay.
Hit the wrong button.
The transitions coordinators will also organise visits or facilitate handovers to post-school options. So they will go and have those conversations with further education providers, training organisations, any events that are out there to support the parent and make the parent aware of that and help facilitate that and advocate for the young person. The transition plan then, that's a formal plan, and the plan sits within, I suppose, the annual review of the statement. So it's part and parcel of that annual review documentation that is reviewed every year. So it's developed at the first meeting in year 10, and then every subsequent annual review up until the child leaves school. And that could be at 16, could be at 18, could be at 19 if it's a child within a special school. I should say a young person within a special school at the age of 19. So the annual review, therefore, is in the pupils' year 10, will involve all of those who play a major role during the post-school years. Schools have responsibility for arranging that annual review, that year 10 annual review, and they will invite representatives of health and social services if they're involved. The career service, an important key role in terms of transition planning, and in addition the child's parents, a relevant teacher and a representative of the EA. And that will usually be the transitions coordinator or the SENLink officer, and depending on who's available. The career service is there to provide vocational guidance and assist the school and the EA in securing provision, advice, counselling and support as appropriate. Career services can also call an occupational psychologist who can contribute to the development of a vocational profile if there are concerns about future planning. So the purpose then of the transition meeting and the plan is to explore the young person's aspirations and views. You are aware that we now have a duty to get the views of the child, and I prefer to call it the views of the child rather than the voice of the child, because there are many children who are non-verbal and they can't express in voice, but they can express their views in other ways and means. So that was under the SEND Act 2016 as one of the few duties that have been commenced through the SEND Act 2016, and guidance and training has been provided to all schools on that, so they have a guidance on how to elicit the views of the child. The purpose then as well is to record the thoughts of the parent, guardian, carer. What are their views for their young person leaving education? Ascertain appropriate provision that may be suitable for adult life. Identify any actions to facilitate the move, and flag potential barriers. Identify the life experiences, useful practical skills, and that could include travel training, other practical considerations, any social or independent skills that are required. So the plan should therefore build on the conclusions reached following discussion at the meeting, and this should be reviewed every year until the young person leaves school. There is some cross-departmental work ongoing and has been ongoing for the last few years. So that's probably of note to committee that there has been cross-agency work via a transitions work stream, and that has included representatives from the Department of Education, the Department of Health, Department for Communities, PHA, Public Health Authority, Agency, the Education Authority and the Department for the Economy. And that has been concluded under the end-to-end review of SEN just by DE, and will now be taken forward under SEN Reform Delivery Plan. I have set out the approximate number of young people transitioning from special schools over the next 5 years. I thought it would be interesting for you to see the numbers are increasing quite dramatically. And this is just special schools. That doesn't include all of our children across mainstreams or specialist provisions who will be leaving education as well within the next 5 years. So you can see from June 25 we have 255 young people leaving special schools. By June 29 that's presumed to go to 539. So there are challenges within this space. There's an increasing demand in all SEN services, as you're very much aware of. This includes the transition service. It is challenging to be able to attend as many 14 plus reviews as possible, especially when you have a reduced service. In particular, the first to introduce the parents, as I said earlier, is so important, introduce them to that process and what can be expected, and to meet key people in the child's life. And the last one, of course, is very important as well. The interim ones, obviously, but the last one to ensure that the parents have the right information, that they're aware of the pathways that are out there, the opportunities, and are facilitated then to visit these. The capacity within health and social care trusts, that is limited in terms of providing disability opinions. It's something that we've taken through the work stream as well, and we are working, and we've met recently with the Department of Health to see how that can be facilitated a little bit more easily. We have a duty to seek a disability opinion from the Health and Social Care Trust under the Disabled Persons Act, but it's getting that information back, and of course, you know, that is an important key piece of information, because we need to know, our health trusts or day opportunities need to know where children are have a disabling condition and how that will impact on access to key adult services. So appropriate pathways for young people in training, education and daycare, that we know is limited as well. Every geographical area is different in what is available to our young people. And meaningful and engaging post-16 opportunities. So with the Minister's recent announcement of Education Update 18, we will need to ensure that there are agile pathways that meet the needs of all of our children with SEN. And there are wider challenges as well outside of the education remit. Special schools and parents have raised issues around accommodation, housing and supported living, and the impact this has on appropriate employment and learning pathways. And they also note that there are limited opportunities for pupils with physical disabilities, as currently most of the supported opportunities don't cater for adults with physical disabilities. And that's the views of our special schools coming through in the survey that was concluded at the end of 2023. Elaine, I think you want to just address some of the transformation agenda.
Yes, given we've moved to the SEN delivery plan, I think it's important to note that it does commit to a number of actions in relation to transition, so including the introduction of agreed data sharing arrangements between education, health and economy. I think we've come a fair way in terms of how we share information with health, so that would be good to see that rolled over then into economy as well. Then work with the three departments and communities as well to develop those appropriate pathways into adulthood. And we heard last week about from Alma White about children who were engaging in the same curriculum year on year, and that's not good enough. That wouldn't be good enough for any of our children. And then obviously then the scoping for suitable education, as Claire's mentioned in terms of the Minister's announcement of post-16. And I suppose to leave on a positive note, since the SEN delivery plan has come out, we have had a number of schools who are excited about that, are motivated about that, and who want to engage with that with their children with SEN. So we're open to any questions.
Thank you. So I think probably just to go back to the beginning of the presentation, because I had planned to ask about the 9,000 number, and I'll be completely honest, I had assumed that was maybe across the whole system of children who are transitioning. 9,000 in this 14 plus bracket. It's a big number, and you've mentioned the pressures around staff and resource. Can you give me an idea, just if you were going to look at this as a full complement of staff, how many staff would you need to be actually delivering this service to meaningfully target 9,000 children? Because we're talking 900 for a caseload feels absolutely off the scale in terms of what can be delivered.
It's impossible, and they can't get to every meeting, but they are available by phone and email for parents who want to contact. And we also have, our SEN advice drop-in centres where, transition coordinators can be in attendance there as well for families to talk to. But yes, that's a good question, and we've been looking at that to see what exactly would be required across each of the areas. Because as you know, some geographical areas, there's limited opportunities as opposed to others. So I would think we would need to double that staff as a first consideration.
That would take you to how many staff?
That would take us to 20.
20 staff.
I suppose it would be important to say, though, we do have the SEN Link Officer role and the SEN Support Officer role now that we have increased in the last year. So instead of having what was 38, we now have 51 of each. So that has lessened the caseload. Now it's still substantial. I'm not, we're still talking about one SEN Link Officer day every 600 children. But when we have more than 32,000 children with a statement of SEN in place, arguably we need to see what the impact is of our impact teams in terms of moving that support down the code of practice rather than, and actually instilling confidence and trust with parents, with schools, that we're getting this right for children at a much lower level, so that there's less of a need for parents to seek a statement of SEN. We will still obviously have the cohort of children that we absolutely need to support through a statement of SEN. But there's a lot coming through now without the support at level 1 and level 2 of the code of practice.
I would say, I think in our forward work plan, we've got the EA coming in around some of the operational outworkings of the transformation agenda, and I think around the statementing process and who gets statemented, who doesn't. Those are questions I'm sure the committee will want to look at. But just to be clear on the transitions process, you outline it as a statutory service that you're required to provide, and what you're setting out today is that you're not resourced to deliver that. Is that a fair assessment?
Given the increase in demand over the last 5 years in particular, we've seen, even Lane has spoken about the recruitment of the SENLink officers. When I took up post as head of service 4.5 years ago, we had 19 SENLink officers, and we've, I think, 17, 18, 19 possibly rounds of recruitment to build that service to cope with the demand coming through. So the numbers have increased through that
So
period.
on this again, just to get back to this service, would I be right in saying my impression is that this has maybe been a service that hasn't had the attention in terms of resource or being prioritised? Certainly when we listened to evidence from Alma last week and from other parents who would contact committee members, I mean, many of them are saying they don't recognise the process that you've set out because they haven't experienced it. So they haven't had a transitions meeting, or they don't have a plan in place that they're aware of. So is there and would I be right in my assessment that this is a service that hasn't historically had the investment or attention that it should have done?
The service certainly needs investment. Absolutely, it needs investment. Because we do want to be out there at all of those reviews. The transition review is tagged on to the annual review, so it supposes that understanding with parents as well, that it's all part of the same process.
So I suppose, Chair, parents might not, maybe we need to be more explicit around this is also the transition review as part of your annual review. So there's learning in that for us that we need to take back, certainly.
Reminds me to some of the evidence we heard in the RSE inquiry, where young people get very frustrated where they're told you have had good RSE, you just don't know it. And I think that is, and I'm not trying to make light of it. It is, if something's not clear and it's not explicit what process they're involved in and what the purpose of the process is, then you are going to get that feedback that you haven't. That parents feel they haven't actually had. They certainly don't recognise that process that you've set out. So maybe there is learning around making sure that parents understand what the transitions process is. There's a lot to pick up. I wanted just to ask one other thing about the transitions plan and process itself first. Once a transitions plan is done and the child is leaving the young person is leaving statutory education, be that 16, 18, 19, who owns that plan? Who has the responsibility to enact it?
The parent and child will own the plan, and the EA facilitates that. In terms of it going forward, young people themselves can share the plan with the provider moving forward.
Is there anybody who's responsible for ensuring that plan is delivered?
It's everybody's responsibility, I suppose. Schools, EA, the Department for the Economy, the Department of Health, depending on what that particular child needs, with that profile of child. So if it's a day opportunity that child needs, it's the Department of Health will have responsibility for taking that forward. If it's training organisation or FE or further education or FE or other higher education institutions, it's the Department for the Economy and those institutions themselves for making sure that that's taken forward. But it's up to the plan, it's up to the parent or young person
statutory standing to say, well, I have this plan, somebody needs to make sure the things we agreed
that's if
happen.
they pass it on as well. Some young people decide not to share that plan. We do encourage them to share it because it helps the ongoing pathway to put in place any reasonable adjustments that are required for that particular person. But some choose not to.
So that's helpful to understand, but just to be clear, because I think the committee is, already sort of thinking to the future in terms of what would be an effective system that works for young people, that delivers the transition process they need. Currently, there is nobody who has a statutory responsibility to ensure that what is agreed between all of the agencies you've outlined and the young person and the parent, nobody has statutory responsibility to ensure that's delivered. Is that correct?
We would have responsibility in terms of ensuring that the plan is in place and that is shared with who it needs to be shared with. But yes, once they're post-19 and leave,
there's no statutory agency owns that plan. Not like a statement. It's very clear. The Education Authority has to act on that statement. Nobody has to act on that plan.
Up until the child leaves, I suppose it's the EA's plan along with the parents, but all of those other agencies should be involved. But yes, once that child leaves school, the remit, I suppose, leaves education.
But ideally, it's already in place, it's already being enacted prior to a child leaving school.
Okay. Just one other question from me then, and then I'll open up to members. You talked about the possible changes around remaining in education or training until 18, with possibly a legislative change coming, and that there's been engagement around what post-16 provision might look like, where there are gaps. In terms of our either special schools or mainstream provision for young people with SEN, are we looking realistically at that being widened out so that special schools that don't have post-16 provision are going to be facilitated to provide that, that potentially schools that don't have post-16 provision that's appropriate for SEND pupils, are there processes at play now that will actually allow that to be facilitated?
Additional plan, I suppose, yes,
Yeah.
is 3 to 19 pathways. And as Elaine said earlier, some schools, I can name a few schools that are actually actively setting up post-16 provision. But yes, I suppose we would like to see those pathways available for those children coming out of year 12 if they still require that type of provision. But we have a statutory duty to those statutory school-age children as well, and you know the limitations in that space in terms of capacity.
That's just then on one specific school on Thornfield, so that the regional centre for speech and language. I know there's been a lot of interest, and from parents have been very interested in whether there's scope for any provision beyond 16 who may have been feeling that there was really positive input they were getting at Thornfield, and then a bit of a cliff edge. Is that something that there is any progress that you can update us on?
What I can say is that there are discussions ongoing with Thornfield at the moment to explore that. So, and we haven't got to the end of those discussions yet, but I can come back on that. So, yeah.
That's helpful. I'll pass it over to the Deputy Chair.
Apologies once again for the interruption during your presentation. I think that must have been the Hugo Duncan show, but I don't know how it came on. But in any event, under the new SEND framework, it's proposed that responsibility for preparation of the transition plan will move to schools rather than the Education Authority. And given the context we're in at the minute, where the teachers' unions have an issue around workload on teachers, are you not concerned that this is going to place, an extra burden on teachers or on schools?
The transition plan is already prepared by schools. They prepare that as part of the annual review documentation. We will provide training and guidance on how to effectively do that and work with schools, but the transition plan is prepared by schools already.
So I suppose it's not going to be it's not a new workload issue for schools.
And explain to me what the distinction is then with responsibility passing to schools.
Has the overall statutory responsibility
Right.
For children with statements. The other thing that will make the workload hopefully a little bit lighter is that all annual reviews now have to be submitted through the EA's EA Connect portal, and that has reduced in terms of all of the work heavy paper-based load that schools have had. So they're submitting the transition plans through that portal now as well, which we hope will help. Schools were asked last year to send all of their annual review documentation through that portal, as opposed to sending a mixture of paper, emails, electronic means. So it's allowing us to kind of baseline all of that as well and see what's coming in and support those schools and get the data from it in terms of outcomes as well.
And are you saying then that this new portal should streamline the whole process?
It will help streamline it a little, yes, absolutely.
Right,
We're
okay.
also in the space of building an end-to-end case management piece, and that's in discovery workshops with our software developers at the moment, so that will also help schools.
Okay, and the Education Minister has stated that Section 4 of the SEND Act 2016 isn't reliant on new SEND regulations being made through the Assembly, so can be commenced as soon as the Education Authority and the Department of Health are ready. So is the Education Authority operating the transition services on this basis in full cooperation with Health?
Absolutely, yes. Apart from what I'd mentioned earlier around the disability opinions, there's work in that space that we're working very closely with Department of Health on, and trying to streamline that process and facilitate Health and ourselves in terms of getting those disability opinions in before the age of 14, and those obviously that come after that as well into the system. So yeah, we are working closely with them, and we do have those.
I suppose I'm asking you that because in other areas where there should be cooperation between the department or the EA and the health department, there have been complaints that cooperation isn't as good as it should be, and in some cases doesn't exist at all. So you're confident that there is full cooperation between yourselves and the health department?
Well, health, and especially the statutory end, which I've been responsible for the past 4 to 5 years, we've worked very closely together. We've had monthly meetings right through in terms of all of the statutory pieces, the statutory advice for statutory assessments, all of that work. So we do work very closely with them, and we'll be working through this, I suppose, the SEND transformation piece as well in terms of transitions. The disability opinions I've already mentioned, and we have meetings in place to address that. Do you want to add anything, Elaine, around that?
I think at our level, there's very strong commitment from both health and education to think that there's issues that need to be better resourced to allow that to happen more efficiently. Yes, of course, but we're never going to argue for less for either department, really.
Okay, fair enough. And just finally, given the rising numbers of young people who are in that transition process, and the expectation is, I presume, that those numbers are going to increase in the time ahead, how difficult is it to find pathways for those young people?
It's incredibly difficult, I'll be brutally honest. It's incredibly difficult. And if you look at the special schools, there was a survey done at the end of 2023 through the work stream that I mentioned, and special schools in particular were coming back saying that the pathways are not there, and some of the other stakeholders were coming back those were the main pain points in terms of transition, that the opportunities weren't available moving forward. So that's...
Have you any suggestion yourselves as to how more pathways could be opened up? Is it resource? Is it better information? Any ideas at all?
Probably a mixture of a number of factors. Resource, yes. Short-term funding has impacted on training organisations and training opportunities for young people leaving school. So there's lots in that space. Daycare opportunities for children who need that extra nurture and care, leaving our special schools with profound and multiple and severe learning difficulties. So yeah, a number of factors.
All right, thanks for that. Thank you.
Can I add, Chair, to that?
Yes, no.
For me, it's about consistency across the north, and providing purposeful, meaningful activity for our children and young people post-19. And we're not there yet because there's the difference in terms of geographical spread, and it's almost similar to when we're talking about preschool SEND placements and P1 SEND placements. We have the same kind of issues in terms of trying to make sure that we get the right provision in place, and we get the right support for that child, as we have them when we get to the end of the education career, if you like.
Thank you.
Thank you. So Michelle, you had indicated next.
Thanks, Chair. Thanks very much for the briefing. I'm going to start with the post-19 Caleb's cause. Obviously, Alma was with us last week, and it was really difficult to listen to the experience that she's having. So the question I was going to start with was around the 14 to 19 framework. There is an action in there to work to identify post-16 and post-19 opportunities for special educational needs learners in special schools. So what kind of involvement have you had in that framework to date?
Education more, isn't it?
Yeah. Our colleagues in the Education Directorate would have had more involvement in terms of that, but operationally and on the ground, if you like, with that first, and I know that wasn't Alma's experience in relation to her son, and we can go back and look at that. And it is, for me, it's about making sure that it's not just about the annual review, that we're very clear, you're starting now in terms of the transition pathway, this is what this means. These are all of the different organisations and resources that are in your local community. And actually our special schools take a great lead in that, because they'll already be part of the community, and they'll already have involvement as to who's best placed to meet children's needs. And sometimes those agencies are already involved with that young person. So operationally, for me, it's about making sure that we know what the pathways are in each of the geographical areas, and that's why we've specifically aligned those transitions coordinators to the local trusts.
Nothing specific there around post-19 opportunities that you're dealing with or working towards?
Responsibility, I suppose, for the Department for the Economy and Health in terms of setting those up and having them available. Schools, and I suppose I should have added to what Elaine said there earlier, schools will have good links with industry and businesses as well, where that's appropriate for a young person leaving school.
So I guess the impression that you're given is if anybody, it's sort of quite a reactive service, if anybody's lucky enough to get a plan, nobody's responsible for that plan. Is anybody monitoring whether placements are appropriate or successful when somebody actually manages to get one? Is anybody keeping an eye on that?
But every child will have a plan, and you know there's a number of things on that plan that will be addressed: their aspirations, their future planning, what they would like to do leaving school, what their parents' views are, what curriculum they're involved within at that particular time. But I've lost my train of thought there.
I just
But
trying to
yeah,
understand if we're keep monitoring
Oh, yes,
the success
sorry,
of
yes,
this. Really,
yeah,
are people
Our
keeping
transitions coordinators-
statistics or keeping
Yeah.
records of just kids getting placed and how successful those placements are? Are they appropriate? Or are people having to go back into the system and start over again?
Transitions coordinators will know where all those children have gone to and what their pathways have been. And I suppose that EA Connect system that I talked about earlier, in terms of schools uploading their transition plans onto that, will allow us to run reports from that as well to see, you know, what the outcomes have been and what recommendations have been made for the young people leaving at any particular age.
Do you keep a record of
We
that?
will be
Statistics you can see percentages of how many people have got placed and
We're building that baseline at
Right,
the moment
okay.
through EA Connect, so I don't want to promise you something
Yeah.
that I might not be able to deliver on, but
it's
we'll
coming
be,
rather than it's there
we'll be
now.
looking at what those transition plans are telling us in terms of the data from that system. But that's maybe a year off at the moment
Yeah.
because
Yeah.
we're only building it this year.
And for kids with the most severe kind of, I suppose, maybe severe needs or behavioural difficulties, how are they dealt with? Are they getting the same level of opportunity as others in the system?
It will depend on those links that schools have with local agencies, voluntary agencies, and what's available in terms of what's set up under health or the Department for the Economy in terms of training organisations or further education. So it will depend basically on what's available in any particular geographical area, and we know it's limited.
Yeah,
So
that seems like a particular challenge that's
it
getting
is a challenge, yeah.
bigger. And is there anything in particular then happening to meet that specific need that's increasing?
The work streams and the transformation work hopes to, you know, I suppose highlight this further, and you know there are plans in place in terms of that in that space to look at what opportunities are available. But it's difficult. It's very challenging.
Michelle, Danny had indicated next.
Thank you, Chair. Thank you for coming today. I suppose I just want to start and just follow up on what's been said. Just see at present, does every child with a SEN statement undergo at least a first and last review as part of the transition process?
They undergo an annual review every year, but in terms of from year 10 on, from that post 14, it will be an annual transitions plan as well as alongside then the annual review process.
Every child with a statement is saying that is?
Yes. But I think, Danny, given what we've heard today and what we heard from Alma last week, we have a piece of work to do to make sure that that's understood by parents, and that's obviously our linking in with schools and with our transitions coordinators and our own EA staff who are attending
I
these.
wouldn't be the experience from what I would hear from parents and carers, if I'm being honest, and also from sort of following on what Pat says, a lot does seem to be falling more and more on the schools. I suppose then children who don't have a statement of SEN, who for a number of reasons why I know this, who would need individual support with their additional needs, where do they fall in this with yourselves? Do they get a plan?
What the Code of Practice says is that schools can develop a plan for those children if they're particularly concerned, and they can get advice from the Career Service and our EA Send Advice and Information Service, or our own transition team as well. They don't tend to bring those children to our attention an awful lot, but where they do, we would certainly support them. But the Code of Practice does say that they can work on a transition plan outside of the statutory process if they
Because
wish
we
to
know
do
the
that.
numbers are so high of children who don't have a statement. So that would actually worry me a wee bit that it's not very often that happens, considering the amount of children who, as I say, may not have got through the process of getting their statement, but certainly need it. And then what we're seeing with so many children now not being placed in the right settings, where they should be in a special school or in the SPIMS. So I would say there's a massive gap there that's been developing for quite some time. So I would be really worried about that.
Those children that maybe haven't received a place in a specialist provision or a special school will be in mainstream with support, and they will have a statement so they will be subject to that annual review process and transition planning process.
Not every
but
child
it's
has a
not-
statement.
Not every child has a statement, no.
And then they're being further displaced, I suppose, as well, that they may have had a place in maybe a unit that we used to be called, or now being put into mainstream classrooms because of the demand that is needed for SPIMS in schools.
I wouldn't
So it
necessarily
means
agree
every
that
child
it's
isn't getting the
that-
support.
Yeah, and I completely agree with you that we have moved away from, the demand does mean that every teacher in school needs to be a teacher of SEN. But I stand over that. I think they should, given we've 1 in 5 children. So if we're talking about a class of 30, that's, my maths is really bad. I'm really sorry. That's 6 children. I know. But that's 6 children then that are in that class. So every teacher needs to be a teacher of SEN. And we need to work hard to increase the capacity of those teachers and those assistants, anybody within a school,
You
to
don't even have
develop
the
that
capacity
understanding.
yourselves to support that.
I think there's different ways that we can look at supporting, and there's different ways that we can free up our staff to do more of that. And one of the things that Claire has mentioned is the digitisation of the statutory assessment process. So that will include that end-to-end case management. So as a parent, that means you will be able to go in and see where your child is at in terms of that whole assessment process. And that's much easier for a parent than having to lift the phone. And that then, in turn, I would hope would free up our staff to be involved in school life, to see the different provisions that are in place, to see what special schools offer and what the pressures are there as well.
See the portal, sorry, is there any barriers that are being, well, not barriers isn't the right word, is there anything that's maybe causing further delay for maybe schools and families with that? Are you saying that will definitely help streamline everything, or is there
It will be more transparent, I suppose, for parents and schools, because they will be able to log on and see what stage their child is at in a process, and that will help. But we
is that
are
the
in the
school
middle
providing
of.
all that support? I'm just thinking, like, there'll be literacy issues in some homes and parents, and
course,
and all the stresses of actually with children. Like, actually sometimes it's forgotten about the challenge of getting sometimes the child from the bedroom to the car, from the car to the school. That's what somebody is that them barriers being looked at and addressed in this?
Yeah. Well, I suppose if we're talking about kind of overarching strategic pieces of work, one of the psychology projects that we have involvement in at the minute is around emotionally based school non-attendance, and that is about making sure that our staff within our schools are aware of what that is, what purposeful measures can be put in place to make sure that once the child is in the school, that the child is better supported, and that is a nurturing, warm environment for that young person to come into. So that's more strategically, I suppose, if that's...
And I would leave me on to give one more question.
Very briefly, just on brief
yeah,
response
I would leave
as
me
well.
on to then that would be the Minister's then send reform agenda delivery plan, because you touched on it. Placements is a part of that there as well. So if we get placements wrong at the very early intervention, then that strategic and where we're heading towards would almost be at a fail at the very beginning. I suppose we'll be asking, obviously, what impact do you envisage on your particular role within this SEN transformation plan? Because the Minister, if I'm right, is hinting towards no child should need a statement to get their education.
That wouldn't be my view, but I do think that we have a situation where we have mistrust, where people don't trust that their child is going to get the right support without a statement of SEN in place. And surely we've got to do something about that, because you're right, Annie, there are many children who have special educational needs who haven't come through for statutory assessment, but we still have more than 32,000 who have. So we've got to increase what we do in terms of stage 1 and stage 2 of the code of practice. And I know you're going to have EA and again in terms of what that means. But we've got to refocus. So because children always go up the code of practice and very few actually come back down again, and there's something wrong about that. Surely if we put the intervention in place, then we should have children who go down the code of practice rather than always going up and staying there.
But it's confidence in the system, as
Yeah.
you said, and that's what we need to build with parents.
I mean, I think that there's going to be a lot of interest in that issue, and I think we'll probably have a good chunk of time when the EA is next in to look at those very specific issues. So I'm going to bring Colin in next.
Thanks, Chair, and thanks to the panel for your presentation and time today. And apologies, I'm not there in person to ask the questions, but In your opening remarks, you touched briefly on the cross-departmental and the multi-agency approach in regards to the input process to the plan. Can I ask, what's been done to ensure that the young person remains the central figure in the transition process?
The young person is centre and crucial to the transition process. It's their views and their aspirations that we need to capture, as well as their parents. So they're part and parcel of that annual review and transition planning process. And as I said earlier, the views of the child are important. We have a duty to seek that and make sure that we're recording and capturing that. And of course, the purpose of review as well is to review that yearly, so that we're being realistic in terms of those aspirations and realistic opportunities then moving forward if they're available. And I suppose from what we've said earlier that there are limited opportunities out there.
That's great, thank you. And then on, I think it was page 3 of your written brief, there's 6 points on what success is dependent on. And the first one, or the first bullet point, is parent, guardian, carer involvement and active participation.
Yeah.
Can I ask, in circumstances where this might not be the case and where there isn't an involvement and active participation from the parent or those at home, what happens?
Yes, good question, and you will be aware that some parents don't engage or participate in either the annual review process or the transition planning process, but our officers will make every attempt to engage with those parents to get their views, and that may be a phone call outside of the transition planning meeting or by email. So we will work with advocates for those parents as well. So where parents have social workers or where they're known to other advocacy agencies, we will work with those people to try and make sure that we're getting their views. Sometimes it is incredibly difficult though. So yeah.
And then lastly for me, and it should be a quick one, what advice would you give to a parent or a carer at home who's concerned about their child's post-school transition?
Well, it's about engagement and having conversations and discussions around that child's profile, what their needs are, what their strengths, what their skills are, what their difficulties are, and what they feel that they can move forward within. Every child will have their own aspirations, or young person will have their own aspirations in terms of what they can do and what they can't do. So it's engagement, it's discussion, it's conversation, and taking the parents through that process. And if it's in a very supportive way, and ensuring that they have access to other agencies that can support that planning as well in terms of advice and guidance around what's available. It depends, of course, on the profile of the child and the child's saying.
I suppose, Colin, just to add to that, I would say don't be on your own with that, and please don't feel on your own with that. And if the child is in the school, the young person, if the young person is in the school, then I think the first protocol should be the school. But outside of that, then that's why we have employed transition coordinators. So linking in with the EA.
That's great. Thanks, Chair.
Thank you, Colin. Peter, you're in next.
Thanks very much, Chair, and thanks, ladies, for coming along this afternoon. When was the transition, just something from your written evidence, when was the transition service started?
It was in and around 2005, 2006. I think that's when the first interviews for transitions coordinators happened.
And Claire, can I ask, how many staff were there at that point in time? Ballpark, you may not have been around. But
there wasn't a transition service, so we didn't have any staff within that area.
Yep.
It was all sitting with the statutory teams across it would have been the 5 education
boards.
and library boards at that point.
Okay.
So I won't have the numbers today with me, but I can find out for you.
No, it's just I'm quite interested in your just the earlier answers around the pressure on the department and the numbers of young people that it's trying to sort of support. So I think as of March 25, you said there was about 9,000 young people in transition. And you, I think, said there was maybe 10 people
officers
dedicated to that particular work.
That 9,000, sorry to interrupt you, that 9,000 is across from 14 right through to 19.
Yep.
So not all those children will be leaving school this year.
Okay.
Okay.
And did you also say it was difficult to get, sort of intimated that there were some problems there. I mean, is it difficult to recruit staff? Did you get as far as nearly saying that? I can say a bit more about that.
Number of rounds of recruitment for staff at all levels across the whole service. So we have a service now of about 220 odd staff, and that's been increasing the Centrelink officers. The transition service hasn't increased in terms of numbers, but we have had staff off, sickness levels, other reasons, left the service, and trying to recruit into that. It's an admin grade post, and I suppose that's maybe part of the difficulty as well.
Okay. Just turning to sort of that thing that other colleagues had asked about, that the relationship between education, health and economy, and the sort of the duty to seek information I scribbled down on the way through there. And you'd mentioned in the way through that, you know, the relationships, and I think pivotal in this is that tripartite approach, but you seem to suggest that actually the duty to seek info and that sort of gaining info perhaps from health and economy wasn't quite at the same level as the relationship you have with health in other areas. Is that?
I suppose we've worked very closely with health over the past for a number of years in and around the statutory assessment process. Those relationships are very well established. The transitions team themselves will have good relationships with the career service, which sits under the Department for the Economy, and with health, where health professionals are involved with young people leaving special schools, and the schools themselves will have those links. I suppose I'm working a bit more closely now over the last year with the Department for the Economy. We've met several times in the past number of weeks, and we're actually meeting with them now in a few weeks' time again, the career service in particular, and we're doing a presentation for them on, you know, our processes and how that works, and just to give them a better understanding as well. And they're doing that likewise for us, and I know they're doing their own research in terms of what's available out there at the moment. And we're waiting to hear that information as well. So it's not that we're not working with them or we don't have those relationships, but we're increasing and working on those relationships all the time.
Okay. I had one more question, just around the sort of pathways and, you know, what happens at the end of the journey for some of these children, where they go next. And I noted that I think you said in the way through that it was incredibly difficult sometimes in that forward transition, if I could put it in that context. I was very interested in somebody else, I think, nearly asked this question or did ask it, but I was really interested in you just mentioning a little bit more about it, about what does a really good transition look like? I mean, so and what are the barriers to that good transition? Is it simply you know, the pure supply of places, or are there other factors that create tension in getting that place? So it was really, that was my final question. I was interested to hear a wee bit more about that particular detail right at the end. What does good transition look like, and what are the issues with that?
Well, I suppose good transition planning will be where everybody that's involved with that child is attending those reviews as we move through from 14 plus, and we have a very clear profile of that child and what that child will benefit from post school, post education, and having that place that has been determined as most suitable then for that child to move to, whether it's daycare, whether it is day opportunities or training, FE, whatever that might look like. And that's obviously ideally what we want for all of our children, that the right opportunity is there for them depending on their profile of need.
Just in terms of that,
just briefly, Peter.
Very briefly, Chair, would you characterise it that there's no issue with the supply end of that arrangement? So by that I mean, you said daycare, day opportunities, FE, and obviously it'll depend on each individual child. But in terms of transition out, are there the opportunities out there? In essence, that effective transitions are being made. It's clearly not a criticism of the service or transitions or anything like that. I'm actually just sort of wondering what it looks like right afterwards, and is there the supply of those opportunities in the wider sector?
I don't think there's enough. I think it is an issue with supply, absolutely. And when we look back at the survey across all stakeholders, that was the key thing that was coming out time and time again from parents, schools, health staff, ourselves, that, you know, the opportunities are, there were high levels of dissatisfaction in relation to support for families, high staff turnover, which was about social services, that was coming through. A mismatch even between the criteria used, because health education uses specific or special, can't get the words out, special educational needs in terms of difficulties, whereas the Health Trust will use the word disability. So there's a mismatch there. Opportunities, post-16 offer not suitable for some children with SEN, and lack of options in FE and training. So those are the types of information that were coming through.
Perfect. Thank you very much for your time.
Can I?
Yeah, no other indications. So, Cara, I think.
I'll be very quick, Chair. Thank you so much. I found today very detailed, so I'm grateful that you're here. Can I just ask then, I know you had noted about physical disability and the challenges that still exist there, and I recall very clearly I had a constituent who's an older man now, but he talked about his years in trying to get work experience as a wheelchair user, and finally someone had reached out and said, I have work experience, and then when he landed on the day, he said he was met with 17 stares.
Yeah, gosh.
And he said to this day it still pains him, it still hurts him, and it is something he'd mentioned to me to try and change. So it's good that the EA is mindful and aware of these barriers, literal barriers that still exist in accessing education and opportunities. What would your recommendation be to this committee, to the Education Committee, to ensure that we are facilitating opportunities for people who live with a physical disability and wheelchair users? You know, what can we do more of? Should we be collaborating more with the Economy Committee, for example, to identify this challenge, to get a more detailed understanding of it and try to fix it?
Yeah.
You know, at the outset, I'm minded to go back to last week when you had Alma here and her challenge to you as MLAs, and I took that as a challenge myself as well. You know, we've got to take the lead in that, so we've got to provide the opportunities for these young people as much as, you know, looking to Department for Economy and everybody else to do that. But I think there is an issue, and that's why people like Alma will talk about this cliff edge post-19. So for all the faults in education, we do provide, and parents, you know, feel secure when their children are in that special school environment on the whole, not all the time, but on the whole. And then it's that post-19, what happens next? So it is, I mean, obviously we've disability discrimination for a reason, so and nobody wants to go down that legal route, but we need to try and make sure that it's right and proper for all of our children and young people, regardless of what their SEN is, that they get that purposeful, meaningful activity. So yes, I think it is engagement across all of our actual government bodies.
And all organisations should, you know, they should make sure that their premises are accessible. We talked about accessibility in terms of other things earlier, but the physical limitations of those buildings, we should, you know, organisations should be right up there with that Disability Discrimination Act and be thinking along those lines. You know, how do we support people with disabilities visiting our premises and coming in?
More and more of our sorry, Cara, to interrupt. More and more of our children, you know, who have a physical disability are in mainstream school, and rightly so. And that is because we've made sure that there are arrangements in place to allow them to have that access.
Yeah, it's interesting because I had a constituent who's a wheelchair user, and they had said they had chosen their secondary school based on how accessible, because it was a one-levelled school as opposed to schools that had a number of stairs. So yeah, I think it still lingers, and there's still issues with accessibility. And then just quickly, because I'm mindful the chair will kill me, Danny had made thank you. Danny had made the important point about children with special educational needs without a statement. I take it there's no legal requirement to provide support to those children, but what support is available for them? Because I know there'll be loads of parents listening in today who, you know, they just feel hopeless, they feel helpless. What's available to those children? Is there anything sort of set in stone, or does it just depend on their current special need? Or
Does it go back on the schools really and what's being
But
planned?
remember though, those children will have either what's going to be the personal learning plan, and some schools are already utilising that, or they will have the individual education plan. So that will be bespoke to that young person and needs to be reviewed along with the parent or carer. So that should include, you know, for those children who are moving on from school, that should include, you know, what happens next. And that's not to say that EA services can't be involved, you know, particularly when we talk about the impact teams and what happens next. We can utilise that as well.
Well, that's it for me. Thank you both.
You, Karen? No other indications. So I just wanted to raise one thing that I think it was Claire you mentioned in terms of the recruitment challenges. You'd mentioned that the transitions officers, it's an admin grade, is that right?
It is, yes. It's a senior executive officer grade, and I think that in itself needs to be reviewed. Because when you think about our schools and the difficulties they're having recruiting classroom assistants, it's more or less in and around the same pay point and same grade.
I think when you look at from the evidence session today, it's clear this is a complex piece of work to bring all the stakeholders together to make sure that the voice of the young person is central, that parents' views are factored in, and that engagement in terms of the other departments. It does seem that maybe there is a need, not just in terms of the numbers you've got, but also that if you're going to attract people into the role, that maybe that needs to be looked at. Certainly a lot for the committee to take away. Could I just check, is there a business case sort of in train with this at all around additional resource for this service?
Something that we're going to have to look at under transformation. I suppose the work stream had been ongoing and we'd been getting the information from that, so that was the baselining position.
I suppose it would be fair to say, with all of that, and I do want to leave it on a positive. When this works well, parents' fears are alleviated, and children get the right response. But again, I will go back to, this is almost like the SEND placements issue. We've got to have the right provision at the end of this, to allow children and young people to succeed, in the same way that we need to do this at the start of their educational journey.
No, we'll leave it there, and thank you for your presentation and for your time today. And no doubt there'll be lots of issues in this transformation space that we'll be hearing from you again on. But thank you both for your time.
Thank you.
Thanks. So, just in terms of follow-up actions, then, couple that I just want to suggest, and then happy through the clerk or any other members who have any that they want to raise. I think pretty clear that there's a major resource gap here, both in terms of people and in terms of the money to run the service. I think those figures of around caseloads of 900. I remember when figures like that were being circulated maybe a year or so ago around SEND link officers. There was outcry about that, because rightly people wanted to know how that role could be delivered with that sort of volume of a caseload. I don't think this service should be seen as as a poor relation to the SEND link officer. So I would certainly want to suggest that we write to the EA to ask whether they are considering a business case around better resourcing this service, but also the department, because it is a key strand of the transformation agenda, and in terms of next year's budget or this year's budget, we are now in 25-26. What the department's view around appropriate resourcing of that service would be. Members are agreed on that. I think we could also flag that is the grading of the role appropriate, and will that be looked at? But happy to open up for any other issues that we want to follow up from that briefing. Danny?
Pop, I suppose the very last bit there about the end has to be connected to the start. I'm just wondering, even just for this year, I don't know if there's been correspondence from the department or the EA in regarding how many children could be possibly not placed this year. Do we know that yet from them? And if not, could we ask that question? Because I'm surely they'll have an idea right now.
I think it's separate, I suppose, to the transition service. But as you say, the whole thing is connected. So I don't think that there should be any objection from committee. I wouldn't imagine around seeking clarity on that. Yeah, Michelle.
I think we asked that last week about the placements at the end.
We asked it of the department, and they weren't clear. So I think if we can add that to the correspondence, that would be helpful, possibly as a separate piece of correspondence for an update on placements. So yeah. Any other actions arising? I would also just maybe add, I think we need to just very clearly, in terms of our communication with both economy and education for the concurrent meeting that we have scheduled, to make it clear that this is something we will be wanting to look at. And Michelle highlighted the 14 to 19 framework that links to this service. And I think from really reflecting back to Alma's evidence, last week, I think to the young people in the system who need this service to work, I think we need to make sure we retain a focus on it. Okay, members, if there's nothing else at this stage, then we'll move on to item 7 on our agenda, and that is our next briefing, and it is, and I'm very happy for the next witness to come forward, and happy to have Professor Paul Downs with us today, who is the Director of the Educational Disadvantage Centre at Dublin City University, and you're very welcome here today, and thank you for making the journey to brief committee in person. I would just draw members' attention to their packs at page 224, which is a briefing note from the committee clerk, and then at page 225 we have Professor Downs' briefing paper. So the evidence session today will be looking at issues around the links between socio-economic disadvantage and educational underachievement, and hopefully some jurisdictional and best practice comparisons. But really we are in your hands for this. The committee has identified educational underachievement and tackling that as one of its strategic priorities, and we were keen to hear about any learning from other jurisdictions. So you are very, very welcome here today. If I can hand over to you for any opening remarks, up to 10 minutes, and then we'll move into question and answer from there. Thank you again.
Thank you, Chair. Specialist emotional counsellors in schools to address trauma and adverse childhood experiences is a glaring system gap in both Republic of Ireland and Northern Ireland. We are playing catch-up internationally. All right. It is a routine feature of many jurisdictions to have on-site specialist emotional counsellors in schools. This is not reinventing a wheel. This is something very routine in many countries, and we really, I think, both North and South are I think now waking up with the pandemic to this issue. They've taken their head out of the sand to realise that this is an education issue, and that it affects children's lives. And the research across early school leaving is pointing to mental health and early school leaving having strong associations. The OECD review of the DESH scheme in the South looked at the issue of mental health. They recognise mental health is a poverty and social inclusion issue. So we see that's there. I would also emphasise that the current sort of set of services that we put in place in schools are in many ways fudges. That they are. First of all, teachers cannot be therapists. All right, they cannot address the complexity of these aspects. It's not neither in their training, and they don't have the time. So we need the specialist supports in there for these complex issues. So the diagram that I kind of gave you in the submission of the triangle, we're looking here at the system gap at the indicated prevention level. That's the complex needs, trauma and adverse childhood experiences. And that is different from clinical levels of need, which CAMHS, the Adult Mental Health Services, may be looking at. That's where there's a diagnosed clinical mental disorder. This is the level before that, trauma and adverse childhood experiences. And I don't need to go through the full list of what they are composed of, just to note that psychology internationally accepts that these types of life experiences are strongly detrimental to children's futures. Whether it's bereavement, suicide, child neglect, you can see the range there, domestic violence, children in care of the state. There are a whole number of them there, and I recognise that your A Fair Start strategy has at least named that as an issue, unlike the South of Ireland's or the Republic of Ireland's DESH strategy, which does not actually refer to trauma and adverse childhood experiences from 2017. Yet the pandemic has, I think, forced the hand in the South, in that now the Department of Education has recognised, in the light of 3 Joint Oireachtas Committee recommendations saying we want specialist emotional counsellors in all primary and all secondary schools, they've now responded to primary schools to put up a national pilot across 7 rural counties, and now focusing on DESH, so-called high poverty schools in Dublin in particular. That has been at the request of principals beating down the doors to the department saying, look, we have students and pupils who are not coming into school because they just are either traumatized, or they lack the morale, anxiety-related issues as well. So we need a proper system response on this. So in the Republic of Ireland, we see it happening in primary schools now with a national pilot. We don't see it yet at secondary schools, and this is really remarkable. Okay, we have a situation where at university level it's routine to have counsellors on site. In third level institutions. Yet is the thinking behind this for secondary schools that trauma and adverse childhood experiences only or complex emotional issues only happen when people become 18? Is this actually, because this is psychologically nonsensical, if so? So at secondary level we have educational psychologists who are not counsellors or therapists, okay? We have career guidance counsellors who, despite the name counsellors, are not qualified in the area of trauma and adverse childhood experiences. We have fuzzy language such as wellbeing programmes that are not addressing this cohort of group, and this group are highly at risk of school disengagement. This leads me then into the related issue in the submission, which is alternatives to suspension and expulsion from school. And this, again, is not rocket science. It is a system absurdity on the left hand of a system to have services trying to keep youngsters in school at all costs, and then the right hand of the system saying throwing them out of school. So suspension as a strategy is a failed strategy. The American Academy of Pediatrics note major concerns with that in the submission I've given to you as well. So suspension, expulsion, we need a change of thinking here, where we may be withdrawing students from the classroom, but keep them in the school for the specialist supports, multidisciplinary supports. It may be a speech and language issue, it may be a trauma, and often is a trauma related issue. Our own centre study on homeless men's experience of education in a largely Dublin context, we found that 2/3 of homeless men had experienced trauma in their lives, and of those a large proportion had been suspended from school. So what you have is a system failure here, where people are being punished for being traumatised, and this has to stop. It is an antiquated systemic response, that approach, including then a version of this now taking off in the south of reduced timetables, which is a huge concern, again, arguably in breach of the right to education. So moving then on to, I'd also just foreground the interplay now increasingly recognised in international research and in a report I led the authorship of for the European Commission, which really highlights the increasing recognition that bullying in school is an adverse childhood experience. There is the scale of research in the last decade and a half to point not only to the mental health consequences, but also the educational disengagement consequences of bullying in school. So we need an integrated bullying prevention and early school leaving strategy as part of an underachievement focus. So they've often been seen as parallel strategic approaches. They need to be much more firmly integrated. Moving then on to the other issues in my submission, which I would argue are, what policymakers kind of like to hear are kind of quick wins. Things that don't necessarily cost vast amounts of money, but which I think can make an impact on underachievement. So one is around a positive school climate is, of course, a major aspect here. Supportive relational spaces in schools, and that the school is not just the classroom. So how do we devise other spaces in schools? And I see nurture rooms are there in the Fair Start document. I would also emphasise here school gardens as spaces, again, where we hear students in inner city primary areas in Dublin, say that it calms them down. They feel more relaxed. They feel at peace. They can concentrate better going back into schools. These are not expensive to instil into the system, across schools, school gardens as cooperative spaces, which would be a very small budget. The conflict resolution skills of teachers is again a no-brainer, so that you have teachers responding to conflict with questions rather than big directions, listening rather than just telling the child the answer. So there's basic communicative skills and approaches that we really need our teachers to have, and so there is a basic question there: how are conflict resolution skills taking place for teachers in initial teacher education? And a related point on that then is also the issue of loneliness. There's increasing research, also post-pandemic, but even before the pandemic, in a Scandinavian context, Frosted et al. Study pointed out that loneliness was as big a risk of early school leaving as academic attainment and poverty. So how we are creating our social spaces in schools, how we are equipping our teachers in schools for those to develop those social spaces is an important initial teacher education focus. And the last one then, just to keep you awake, is the topic of sleep. That is a hugely neglected issue, with easy media headlines such as governments being asleep at the wheel on this issue, or they need to wake up on this issue. But basically, obviously there's the right to rest. That's in the UN Convention on Rights of the Child, but we don't. It's not a huge amount of investment to develop teachers' awareness of how children and young people can just be aware of their sleep patterns. Because if you're not sleeping, you're not concentrating in school, you're not motivated, you're not going to learn, you're going to be in conflict mode with your peers, with teachers. Almost every educational indicator is going to be affected by issues of sleep. One of our studies, published in the Irish Education Studies Journal, pointed out that even a 6-week intervention from one session a week with late primary schools in areas of high poverty, where the teacher leads the initiative, in self-reflective diaries, so the kids are self-monitoring their own sleep patterns to see how much sleep they're getting on a weekday and at a weekend. We found in 6 weeks we could get notable changes in going to bed earlier before on school days, though not at weekends. But still, after 6 weeks, it just shows how little is needed to draw attention to our students' views on this issue and self-reflection on this issue. So it's important just to know that I'll finish this one, is that it's not a didactic approach where you're telling the students you have to go to bed earlier. It's about them taking ownership of this issue. It's constructivist teaching methodologies that teachers would be very comfortable with across the systems. Again, this is an underachievement related issue. Thank you.
Thank you very much for your written briefing and your presentation. I think the first thing that I would just say as a comment, I think we have a tendency sometimes to compartmentalise issues in education. So we're going to think about educational underachievement here and maybe attendance here, bullying here, health and well-being here. I think as a starter, you have just drawn out the interconnectedness of all of this. You cannot just talk about educational underachievement as a separate issue to all of the well-being issues that you've highlighted. So that's been a really, really helpful start for me, just to refocus the thinking on the connectedness of some of this, some of these issues. I wanted to ask, just to pick up on the suspensions, but first of all, just wanted to ask on that, and then there's other things I wanted to look at. I had a meeting earlier in the week with a group coordinated by Children in Northern Ireland, which is a sort of an overarching group that coordinates sort of the community and voluntary sector who have interests in the rights of children. And almost without exception, going around the room, everybody raised concerns around this issue of sort of informal suspensions, reduced timetables. And I had asked a question around that, and the response that came back from the Minister was that there's simply no data to record how much of this is happening. How important is data in terms of understanding the scale of the issue, of how much of this is going on to enable us to tackle it? Because I was concerned that we actually didn't know.
Yeah, this was an issue which I raised before the last DESH action plan in 2017 with the in the South, the Department of Education there. And I raised the concern that this was neither being monitored nor schools being given the resources to develop alternative strategies. And what they did instead of what I was hoping them to do, which was to put in extra supports, they just did a data collection exercise. So basically what that then did was it legitimised a process that was unofficial and hidden, and that really was bad practice from the start. So by just gathering the data on it, you were actually almost emboldening schools to then use this as a new strategy in their repertoire. I'll just give you an example of this. I saw a 7-year-old in one school whose mother was a heroin addict, and she was in a daze coming into the school. And the school said, well, we have no supports for this 7-year-old child. So what was the strategy the school did? They sent the child home early, regularly. back to the mother who's the heroin addict. Okay, so that is a system failure. So I would be very concerned if this is being used then as a practice coming in here as well. I think you could argue it is in breach actually of the right to education, especially at primary level.
We need to understand the prevalence, but that's not an exercise in giving permission. It is around understanding the prevalence to then look at how we can support schools to look at alternative strategies. Have I understood that correctly? Yeah, okay. I wanted just to you mentioned, and I was interested in this, it's been something we've discussed a lot at committee. You mentioned multidisciplinary teams supporting schools in terms of, rather than suspending or removing a child, that there should be a wraparound support that comes in to look at supporting that child. Can you give us any idea in terms of either from your research or what you've seen as good practice from your work, what professionals would you suggest need to be involved in a multidisciplinary team? And should they be situated in the school, or is it something that can be brought in as required? What works well?
In the Southern Irish context, at the Oxford Education Committee there, I said to them that in Denmark you have a multidisciplinary team for every school. We're just looking for one for an area. If we could even get that, how brilliant it would be, and particularly looking at areas of high poverty. So if you're looking at, okay, in my view, what we need in these teams are, number one, specialist emotional counsellors. Number two, speech and language therapists. Obviously, you could have a behaviour issue that may be a language issue that may be, need to be addressed in interplay with the counselling aspect. So now I think the other part that would be a family support dimension. Now, in the Homeschool Liaison Scheme is one example of that in the Republic of Ireland. Now, I think there are strengths to that approach, and that could be more part of a team. That is a teacher going out to engage with parents and families. The OECD have raised the question about whether this could be broadened beyond teachers to include other professionals such as social care workers as distinct from social workers. So I think social care workers who can engage, or family support workers who can engage in a non-threatening way with families to get, and we're talking here about the high need families, family outreach supports there. So I would suggest family support worker, specialist emotional counsellor, speech and language therapists as the key aspects of such teams. This is increasingly been seen in European policy context as an issue, as well as the OECD and international and the UN as well. So we need to move towards the idea that schools are not just around teachers. It's often said schools can't solve the problems of society, but if you broaden the concept of school to include not just teachers but a wider set of professionals, then you can have a situation where many of the issues, now not all, but many of these issues can be addressed, because no one profession has all the answers for complex issues.
In terms of your experience, so in your context in the South, is that a sort of in terms of funding, is that jointly managed between education and health, or is there one department that takes the lead? We have a perennial problem here of it's sort of, it's like it's kicked back and forth between the two departments to say, well, that's for you, and it doesn't often then land where it needs to in schools. Well,
this is still a nascent area in the South. We are. I was involved in designing one such team in Ballyfermot in Dublin, some years ago, and there was difficulty of getting funding from different strands. Different ministries were funding different elements of that. What that group would say is that they would love to have one lead department who was overseeing that, whether it's community sector, children's ministry sector, education, health, how you bring those together. I think that the penny's finally dropped. I think now, even the recent election, in the South, we're seeing more of commitments to the issue of multidisciplinary teams. There's a term used now called DESH Plus. This is the idea that you put these teams in the high need schools in particular. You start with those in areas of highest poverty. I think it's important as well to note that, yes, these teams are expensive. So these are direct delivery multidisciplinary teams. These are not sipping lattes, just talking about kids, not giving direct service intervention. So it really needs to be clear what their caseload is, and also that each member of the team can get recognition for their distinctive contribution. Who leads that team is less important than the personality of the person who can mediate between the language of different disciplines.
Thank you. I'm going to pass over to the Deputy Chair.
Thanks, Chair. Thanks for coming in, Professor. And it's very interesting what you have been saying, and there was some data came out just recently there, it might have been just yesterday, that the rate of suicide among young people is 3 times, the rate in disadvantaged areas is 3 times the rate in more affluent areas. And I mean, I know you said in your opening remarks that we've sort of taken our head out of the sand in terms of our recognition that there is trauma and adverse childhood experiences and so on. But here, just 2 years ago, the decision was taken by the department to cut funding for the Healthy Happy Minds programme, which was aimed at providing counselling for children with emotional and wellbeing issues in primary schools. So that has been scrapped completely. When it comes to providing that wraparound support we're talking about, particularly for children with additional needs, when we asked the department and the Educational Authority how many children, for example, require speech and language therapy, how many therapists are there, what are the gaps in the system, we can't get that information. So there are fundamental problems there, and I'm glad to hear that in the 26 counties that at least the department there has begun to place specialist counsellors, emotional counsellors in schools there. I'm sure there's a long way still to go to roll it right out across the whole system. But we're interested, I suppose, in the DAESH system in the 26 counties, because in recent ESRI comparative research between the systems north and south, it shows that there are far more young people here leaving school without qualifications, with the knock-on effect that has on society in general, and far fewer going on to third level education here than there are in the south. I'm just wondering, I mean, the DAESH system was set up almost 20 years ago. Have you any idea yourself? And I know your specialism is in psychology in terms of education, but what impact has the DAESH system had overall in terms of educational outcomes?
As you know, it's a prioritisation of resources for, towards schools of higher poverty, and we have, I think, until the pandemic hit, really made incremental progress year on year. So up to the pandemic, we had, you could argue the DAESH system was a glue holding, much of the society together, because child poverty figures were soaring after the Celtic Tiger crash, and yet our educational outcomes were increasing regarding literacy, regarding attendance at school, regarding early school leaving figures. And one of my roles is that I go into DAESH schools a lot as an examiner of student teachers, so I see the school climate in those schools. And so I think that would be one of the first things I would say, is that there is a very warm, supportive school climate. You go in the door, and the word climate is a very well recognised term now, both in psychology and education. It might seem as a kind of vague term, but it's very tangible. When you go into a school, you see the atmosphere, the kind of the relationships, the colours on the walls, how happy the children are, how consulted they are, how democratic they feel the spaces are. So I think the DAESH system has helped largely, particularly at primary school level, but I think to some degree also secondary school level, created a positive school climate where students have aspirations and hopes, and some of the gaps between DAESH schools and the other schools have narrowed, not quickly enough. So I would say that there have been successes also around literacy, in the sense that that there was a big acceleration of focus on literacy. We see internationally that literacy levels decreased even before the pandemic, and there the Republic of Ireland did not go down like many countries. We actually held our scores there, and that seemed to have been partly because there was an acceleration of focus on literacy. And literacy is a huge issue, in DEIS as well, because and PISA recognises this as well, is that if you've got low literacy levels, you're higher at risk of being bullied in school, which, as we mentioned, is a risk factor for early school leaving, and also for early school leaving. Poverty is associated with being bullied at school also. So internationally. So I think the combined literacy focus plus the emphasis on school climate dimensions have been very important factors in the success of DEIS. But having said that, that is up until the pandemic. Since then, we've seen a fallback, and that's why these other issues I've mentioned earlier in particular do need to be addressed.
And in terms of how that is addressed, does it require collaboration between the education system and the health department? Because we have a system of governance here where departments are effectively independent republics on their own. There is the Children's Services Cooperation Act, which is supposed to impose on departments the willingness to work together. Doesn't always happen, and there are problems with it, and there isn't necessarily funding that goes along with that. So, for example, in terms of, so we have an education system, we have difficulties within the education system that require health input. So we need counsellors for children with trauma or adverse childhood experiences, or, as you pointed out yourself, bullying and so on. And I'm just thinking, I think we have about 1,000 schools here in the north, and if you were going to put a counsellor, for example, and a speech and language therapist, never mind a whole multidisciplinary team in terms of the resources, each minister is sort of precious about their own budget, when in actual fact, if they were to work together, it could have a longer term impact on reducing incidents of, children leaving, young people leaving school without qualifications, mental health issues in future life and so on.
So I fully accept your argument for interdepartmental communication. I'll come on to that in a second. What I would just say is that we have managed, I think,
briefly as possible, with times against us.
Sure. In the South, to get the education ministry, at least the previous one, to recognise that mental health is an education issue. It's not just a health issue. So education has to take the lead in putting the counsellors into the schools. And I think your Fair Start document does commit some budget towards that at primary level, but my argument is that it needs to be extended also into secondary schools. Regarding interdepartmental cooperation in the South, you're getting aspects of that, to the Children's Ministry. It's a work in progress, I would say. That's an international problem. I was involved in the European Commission 2014, asking them to put a survey across Europe of cooperation across health, education and social service ministries, and many countries were weak on those collaborations. So it is a change in thinking, but it's happening now. Is it happening quickly enough? I would argue it needs to happen much more quickly in both areas.
The difficulty, and I'll be very quick here, Chair, the difficulty is that if education wants to recruit counsellors, it's the health department that trains counsellors, decides how many places there should be in universities, for example, to train counsellors and so on. So we have difficulties here, maybe that are unique to here, maybe not. And the other issue, of course, is academic selection, which puts children under enormous difficulty, and I don't know whether you're across that issue or not.
We're very nearly out of time here. In fact, we are out of time, so
okay.
Answer
I might come back linked to another question.
Okay, that's grand. Cara, you were next.
Thank you, Chair. Professor, thank you so much for being here. I found your briefing really fascinating to read, and you can just tell your passion about this entire subject through your oral briefing here today as well. I think mental health and schools, we've seen there was a scheme around Happy Healthy Minds, and the funding was cut for it, and that entailed sort of music therapy, art therapy, and giving children the opportunity to express how they're feeling emotionally, and that funding was cut. And we heard from some parents, children were finding out less than 24 hours before their next session that there wouldn't be a next session. So I think it couldn't be more timely that you're here today to really speak to the importance of having trauma-informed counsellors in both primary and secondary schools. I think you made some really fantastic points there about bullying and emotional-based avoidance with schools. I had a survey recently, and we spoke with hundreds of parents just about the experience of their children feeling isolated in the school space, and that they don't want to go back. And some of those issues, if not the majority, was around bullying. The chair had touched on briefly our data and monitoring here in the north. I found we had a session with the Department for Education. I found that our policies on bullying, I found them very weak. And, the department couldn't point to the nature of bullying, whether it's homophobic, sectarian. They had no data on that. Do you think, what more do you think we can be doing on bullying? Do you think we need better monitoring? Do you think we need better awareness campaigns? What can we do as an education committee on this issue?
Okay. So one low key in terms of low resource point that every school could do is have a driving committee in the school for a whole school approach to students' voices, well-being, of which bullying is part of it. So that would also include issues of challenging authoritarian teaching, ruled by fear, but that would be a committee with some teeth, perhaps with the principal being involved in it. So that would be a driving committee in every school. We recommended that in one of our EU Commission reports. As one obvious aspect. The other point would be to intervene early. This is where the counsellor point is so important. To intervene early to stop the consequences of bullying getting worse. Mm-hmm. So what you have is victims of bullying, as well as the perpetrators actually also need these kinds of supports too. Is the victims of bullying get into a cycle of self-hate, self-doubt, and the terms often used as double victimising, where they blame themselves. And so you need the early intervention quickly to stop making the fire basically go further. So the counsellors can serve as an early intervention approach in the school to support, to address that aspect. I would also note as well is that we're looking here at one-to-one counselling supports. That some of the terms regarding sort of well-being programs are at the universal level of a school, or maybe some group-based stuff. Now the serious gap in our DESH strategy has been for the one-to-one specialist supports. That's the part, and we want to get away from these. 20 years ago, when I was designing the service in Ballyfermot, we were seeing these 8-week bereavement counselling support. You cannot, in 8 weeks, overcome, the death of a parent or whatever, or a major figure in your family, or a suicide-related issues. So some of these things have been gimmicks in the past, frankly, and they need to stop. These need to be sustained supports, so that the counsellor is embedded in the school as a staff member, not rotated on very loosely across a panel of many schools. So we would argue for the special counsellor be in at least in 1 to 2 schools embedded there, and that this is not a teacher, this is a different role.
Fantastic answer, and definitely something we can take away after your briefing. Just then, the last question is, I was really surprised, I was reading a book by Dr. Nadia Burke-Harris on toxic childhood stress, and how adverse childhood experiences shape not only life experiences but life expectancy. And I'm just mindful, because we live in a post-conflict society, there's so much going on. You have post-conflict division, you have addiction, high rates of domestic violence, high rates of suicide, as you've already alluded to. For me, I have a particular interest in addiction in the home, and I was recently speaking with the National Association of Children of Alcoholics just about how addiction really shapes the life of a child in a home. And when we're talking about educational underachievement, I really want to keep our eyes on those children, because oftentimes I think they're sort of the issues kind of pushed to the side. Can you speak to that at all, just about how addiction in the home shapes the minds of children, and perhaps what we can do more of as a committee to support them? Because I know what you had said there about early intervention, early support, and then later in life you'll see the benefits of that.
Yeah, sure. So you're talking about family support, outreach workers to the home, family therapy supports that may be community-based, possibly more than school-based. In the family-based service that was involved in its predecessor in designing, the term that was used there was that you're not necessarily going to be able to solve all the issues of the family, but you can have supports to alleviate the impact on education for those children, so that you can stop some of the consequences of the family difficulties on the child. So maybe about ensuring they get to school. It can be those kind of emotional counselling supports. But it's very important though that there is a strategy for the different levels, and so there can be obviously collaboration. I think schools could do a lot more with family support services. I asked this of many school principals actually. What are your links with the family support services? Maybe just down the road, and often there's not huge links. So again, now there's also a privacy issue here as well for families to address, but we do need to recognise, and I note as well your Fair Start document does go into does acknowledge that mental health issues, I think, are 25% higher in Northern Ireland than they are in the rest of Britain. So in that situation, it is an issue that is particularly impactful, as you noted, in this context. So it really behoves you to make a systemic contribution here. But again, I would just urge you not to repeat the error I would see, of the South, which has been to put them in primary schools, and I see that's in the document. It's great to have them in primary schools, we want them, but the secondary school area, it's quite remarkable that secondary schools are being omitted from this strategic approach, because, to be clear, to reiterate, guidance counsellors, secondary school teachers, they are no substitute, and generic wellbeing pre-packaged programmes, none of those are adequate substitute for the complexities of the one-to-one tailored support, specialist support.
That's really helpful, and thank you so much for those answers, because I was looking through some of the stats, and it was 1 in 8 children in Northern Ireland have emotional difficulties and struggle with their emotions. So how, when we're talking about education, we have to see these things and how directly linked they are with one another.
And these are pre-clinical levels, so this is why it is an education issue, not simply a health issue, because it's prior to getting to the level of the clinical diagnosis to stop these happening in the future. But these have big educational impacts at that preclinical level.
That's brilliant. Thank you.
And it may just be worth pointing out that the Fair Start document did highlight the need for primary counselling, and we ran a pilot, as the Deputy Chair alluded to, but then the resource wasn't put in to do anything more with that, and we're in probably the opposite scenario to you, where we do have a counselling service commissioned in secondary post-primary schools but nothing in primary, so we're completely flipped the other way despite the recommendations of Fair Start. So maybe just different problem, but two sides of the same coin. Yeah, that's right. Okay, Michelle, you'd indicated next.
Thank you. Thanks for the presentation. You inject a lot of energy into the room, which is always welcome. I'm going to go back to the bullying stuff that Cara raised. It's something I really have had a bit of an interest recently. We met with the guys in DCU with the work that they're doing in schools in the South, which is hugely impressive, and their emphasis is very much on, as you have referenced, the preventative side. We do have legislation here, but it is quite a reactive approach. Like, the teams do a great job, but that preventative approach to bullying seems to be particularly effective, or very much what we need. One thing you also referenced, just to connect those, was you talked about poverty being one factor in terms of why people are bullied. Are there any other specific demographics that are more likely to be bullied and then face the consequences of school avoidance and underachievement?
Well, obviously that depends on the jurisdiction and the context, but there are well recognised discriminatory bullying concerns, whether based on ethnicity, religion, based on sexuality. There are many aspects there that you would look at, jurisdiction by jurisdiction, internationally, to see,
where we don't capture that data from schools specifically and what the reasons are. So that's something.
Sure. So that is very important. I'd also just emphasise that the class teacher can, for bullying prevention, really generate the climate of cooperation and connection in a class, and then a whole school approach is very important for creating a system of supportive relations. So even something as simple as group work in a classroom, in a primary school classroom, there you're developing perspectives on cooperation, negotiation, that each person can interact and listen to each other, listening skills. All of these are kind of broader social skills and capacities that we need to build into our education system, which I do think, in fairness, I'm sure you're doing. But so they are the kind of wider sort of system protections before you then have the sort of the driving committees in school as well. There's, I think, also the other issue that has been risen internationally has been discriminatory bullying by teachers. There was a study by Alame et al. That argued that not only the fundamental importance of the teacher's role in integrating minority students or migrants in the classroom, so that when they were treating them all equally, then the pupils and students picked up on that and didn't start bullying those migrant groups. So that the teacher can set a huge role in the classroom culture, and the school can create a culture of cooperation that is important. As well as, I suppose, the point that was made, I think, in a Norwegian context, was that some school principals don't want to face this issue. They want to pretend it doesn't exist. So it's very, very important that you have a culture of support for principals to address the issue and to confront it, and not try to sort of see it as a poor reflection on their school. This is an international problem that we do need to address systemically, but it has a very big impact on early school leaving. And it's not rocket science. If any adult in the workplace was being bullied, you would probably either complain or walk out, but you would probably end up, your attendance at work would be hindered if you're going into an atmosphere. So there's also a study that notes that internationally that fear, so you don't even have to be the person who's the victim for this to impact on your school attendance and on early school leaving. So even if you're the person who, it's just that you're going into an environment where the fear, the term I think is the prevalence and fear of teasing climate. So if you're going into an environment where you might be bullied, it may not be you today, but it might be you on Friday or whatever. So even it's just that the fear of it creates this lack of engagement or a willingness to avoid school. So we need to synchronise and integrate our underachievement focus with a robust bullying focus, a prevention focus here.
Yeah, so the idea of the teachers, their role in this, and then I suppose their training and support around bullying, because I've had a case recently where I think what they said to us in DCU is you have to be decisive and act really quickly and don't let the thing fester. And you mentioned that as well in your evidence. Something went on for a year. Now the impact of that on that individual child is devastating, but you're quite right. In terms of how she is perceived within the wider school community, that child's on her own now. Nobody comes near her, nobody talks to her. So the effect of that then on her educational performance, it's just been absolutely devastating to the family and to that child. But how do teachers then need to first of all recognise that has happened, and I guess be equipped with the right skills to identify that stuff easy and be empowered to act on it?
What I would also say again, though, is that having said that, again, I suppose it's the sort of universal level of how the teacher's role in creating the climate of the classroom. But there's not just one bullying problem or issue. So there are different motivations from the bullying perpetrator. So there will also be that entrenched group, who maybe have experienced a lot of pain themselves. Going back to the trauma point, so they may be the perpetrators who are perpetrating basically a chain of pain. They're in pain. They externalise their pain to hurt others. And there's research to show that entrenched bullying from age 7 is a predictor of later psychiatric problems, never mind criminality issues. So there is that issue of also the family support dimension. There may be family issues at home that may be then spilling out into some motivations for the bullying perpetrators. So again, I don't think it's fair that the teacher would be the only professional to address that layer of complexity. That's why we need the family support outreach workers, we need the counsellors, the therapists in school, and so that integrated approach can kill a few birds with the same stones. In that there's a number of issues, so you have a number of diverse problems, but that can be solved with common system supports embedded in a sustained way in the system.
Thank you.
Michelle. Peter, you were next.
Thanks very much, Chair. Paul, thank you so much for your evidence today. I suppose my first question is a sort of technical one. So I wrote a policy document for my party. It was the DUP. It was the first one that ever looked at ACEs and trauma in Northern Ireland in 2018. And whenever Fletty did the ACEs, Fletty initially had 8 and then it went up to 10.
Yeah, sure.
I was just wondering, because I might have misinterpreted this, you have a kind of list there in the evidence you've given us to us today. You've got a list that starts with domestic violence, substance abuse, neglect, mental illness. Is that your interpretation of ACEs, right? Is that a list of your ACEs, or is that things that contribute to them?
Yeah, no, they are internationally recognised ACEs that have, that have been developed over, over a number of years. The only one that's my interpretation is bullying in school. Okay, that's the only one I've added in to the previous list. I put that in on the basis of our EU Commission report, where we saw not only the range of research in the recent decade or so pointing to the long-term impact, and these were very impressive studies going, large-scale samples across many jurisdictions, pointing out the long-term impacts of bullying on physical health, mental health, and educational attainment. Mm-hmm. So our engagement. So all of those aspects. So bullying is the only one that's my twist within those. So you're right to point out that whether any of them are my particular interpretations of ACEs. So that one is, and but I make note, just to note as well, that a European Parliament committee argued that bullying in school is a child protection issue, not only a child welfare issue. They went as far as that, and our report 2016 for the Commission came to a similar conclusion based on reviewed international evidence.
Brilliant. I'll keep going, and that's really, really useful. So you have I think there's 14 there. I'm sure you'll know the answer to that. I'm not sure, but I think I counted 14 there. But actually, in the Fletty list of ACEs, or even in the revised list that WHO put out, I think in 2020, which went to 10, I mean, they have, I'm going to say, additional ones to the ones that you have. So you have abuse in there, but they will actually say there's 3 separate ACEs within abuse. There's sexual,
absolutely, domestic. I've shortened that. Yes, you're correct.
That's fine.
I've shortened that.
Would you say so? If we sort of added together the list that you provided and added together even the 2020 list from WHO, it would form quite a long list. Okay, would you accept that perhaps by extending out what was initially quite a short and succinct list of factors that Fletty and later revised said these are key, does it dilute anything in your eyes, I suppose, is a question I'm heading towards?
Yeah, I look at this from an educational perspective, okay, of underachievement and risk of early school leaving. Yep. So from the, as well as system solutions. So from the range of issues there, mm-hmm. these would all be predicted to impact detrimentally on educational achievement. So from that perspective, I'm not making that distinction. And there is quite a simple common system solution that I've proposed of the specialist one-to-one counsellors in schools. So yes, and of course they'd also be interconnected. And as I'm sure you're aware, Sir Michael Rutter's work on ACEs initially points out that it's not even the particular risk factor, it's the cumulative number of them.
So 4 was the accepted number that was a sort of a baseline for risk. So
when you add them together, and of course the other one you could put in is the global pandemic, as whether it's it's a risk factor. It's maybe not an ACE, but it's a risk factor on top of those other ones. So that is part of the rationale for why post-pandemic we really need to accelerate a focus on this issue.
Okay, no, look, that's very useful. I'll just keep going. In terms of you mentioned on the way through speech, I think I scribbled these out right, but you get a chance to correct me here. Speech and language counselling and family support as key units, perhaps within the DASH programme, that are quite transformative in terms of schools and so forth. Did I get that list right, sort of?
Okay, the family support part in DESH is a teacher, okay, homeschool liaison teacher.
Yep.
The OECD has argued that could be broadened beyond a teacher. There's arguments for and against that, but as part of a multidisciplinary team, you know, for the high need families that,
Yep.
that your colleague I think referred to, that for those I think you need skill set beyond simply a teacher. So you would need social care worker type supports as distinct from a social worker. Okay. And then the DESH strategy around counselling is not in DESH, it's something that's come since DESH in response to the pandemic. The last DESH strategy is 2017, but the social inclusion unit in the Department of Education has now managed to get 60 DESH schools with counsellors in Dublin, and that is the new strand that has come through since last October.
Okay. Well, that's very useful, and I don't doubt, and I carry the flag, especially for speech and language as an early intervention at the committee in terms of the impact it has. I'm going to take you all the way back, bearing in mind that those were
Briefly, Peter.
Yeah, oh, absolutely, Chair. Bearing in mind those are all very useful in terms of interventions, especially when they're done early. I'm going to take you back to the title of your report, which is a socio-emotional health focus to address educational underachievement and socio-economic deprivation. In your research, Paul, in this paper, it says a health focus. Is it your understanding in terms of how the government works in the Republic that if this was to be realised, is there any mechanism that health, recognising that actually these things have an impact on kids, the earlier that intervention occurs, the better, and for that matter, the cheaper in terms of interventions, because the longer these things go on, the more expensive they get to intervene in, and the worse outcomes for the individual or the child. Is there any mechanism that, or any collaboration in terms of budgets? Because a lot of what you've said is really, really good. The question the committee would then have is, how do we fund all this? You know, if we were to take this and bring it up to Northern Ireland, how do we do that? Is there any collaborative work at a budget level that you're aware of between health and education in the Republic in terms of funding any of these programmes? And if so, what would it be?
Just say,
Peter promised me he would be brief. If I could ask you to please be brief.
That's one of my briefest ones,
I would throw justice in there, that there could be potential early prevention justice approaches that could come in there for funding strands. Okay, in the set, what we have is 5 different ministries, all nominally addressing this issue. Okay, we have not only the education, health, and the children's ministry. We also have Taoiseach's office has an anti-poverty unit as well, and then you can go into others too. You can make the social protection, unit as well. There's hot meals. So you have actually 5 different ministries. All right, and the collaboration, of course, could be better. But the question you ask is the one that I'd be putting as well to our education ministry would be, yes, can you engage the health ministry to take some of their budgets for joint collaborative initiatives? That is a live issue. So there are a lot of models of interdepartmental groups, and DESH itself was an interdepartmental initiative and is one largely in the children's ministry and education, but it does certainly need. I think the pandemic has opened our eyes to a lot of these issues as well. So I think there's certainly that strong argument that we need that extra limb in there. But again, I would also just make the point that trauma and adverse child experiences is an education issue and not only the preserve of health.
So Donna, you were next. If I could just ask members to get to questions as quick as possible, just so that we're not beaten in time and that we get through all the inquiries. Donna, you're next.
Thank you, Chair. And my first one will be quick because it's a follow-up of a Pat you didn't get a chance to really answer, and it was on academic selection. Children here at the age of 10 who will be labelled failures and to sit that exam. So I'm just going to give you that opportunity to sort of answer when Pat had started.
Yeah. I think it's very hard for any educationalist to support academic selection at age 10 and the failure identity that comes with being labelled failures. I think and there's international, the OECD has pointed out that their 10-step Secretary of Education has talked about delaying academic selection as well. So the argument is to put it back as far as possible in the school, in the school timeline. So for example, that you're for state exams, you may need to have, honours maths classes compared to, to other subjects. So the idea, I think, is that sure, it has to be addressed to delay selection as long as possible. There's obviously the issue as well of the differentiation teaching skills of teachers, how you work with those to teach different levels. So at primary school level, part of our work is and we examine students on their capacity to differentiate different levels within the same class. But certainly, the OECD, as have the EU Commission, and many international groups have, pointed to a swathe of international research on trying to stop, early academic selection, as well as kind of, failing students, not letting them progress with their age group. The discriminatory effects of this on, for example, the traveller and Roma community is very well recognised. So all of those aspects there are, so I've honed in on certain limbs of an underachievement strategy, and I recognise there are wider other ones to hone in on. It's not necessarily the one that's been the focus of my work today, but there's so much international research on the damaging effects of early academic selection. Sure.
And would it surprise you then that the Education Minister has no interest in addressing the fact that we still will have academic selection at the age of 10?
Okay. When in terms of surprise, I'm not going to go into an emotional response on individual politicians. All I could state is that an international research would, from the OECD, the EU Commission, these would all point to the importance of delaying these processes as far as possible.
It does tie into everything that was being said that they, particularly we look at school attendance, for example. The constituency I represent, you would have a grammar school, say, just a stone throw away from a comprehensive school. But if you were to look at the school attendance, it can be as high as 96 to 97% for the grammar school and as low as 82% attendance for the comprehensive school. So it's that knock-on of probably the comprehensive schools always having to do the heavy lifting when it comes to the support that's needed for our young people and their journey.
I think if you look at the issue of non-attendance itself, again, it's a behaviour of which there are many different motivations. Yeah. Just as if you go into the city centre today, the reason why you go in would be a different motivation for someone else. So from the same behaviour, you can't draw a one-to-one correspondence that there's only one motivation. So what I would be asking is, ask the young people themselves, why are they not going to school? And what are the reasons? And you will find a diversity of reasons there. Some could be linked with bullying, we've mentioned already. Some could be due with loneliness. Others can be doing with issues of peer exclusion and the one that I would have heard a lot over the years, in an such an Irish context, has been the one of of clashes with this class teacher. Okay, that a lot of the teacher's communication skills, so that the teacher talks down to the teacher's picking on me. Now it's a perception, doesn't mean it's true, but what it means is that so teachers not communicating through anger, using so I mentioned there's sort of practice approaches there, which are no cost, they're free. They're kinds of questions that teachers can ask to foster the empathy skills of the students, their own empathy skills and perspective taking skills. So there's a whole range of reasons why a young person, and of course discrimination is a big factor as well in many contexts. So again, it's about a whole school system strategy for what, in the term we've used with the EU Commission reports, has been for inclusive systems. You create an inclusive system in your school where students feel treated fairly, where they have a voice. There's a Greek study that pointed out that the schools where most bullying took place was where students felt they were being treated unfairly and were alienated from the system. So it is about a whole school system approach and a whole community approach as well, to creating the basic point that environments where students want to go to. Yeah. that's another point. It's just and so school has many different spaces. It's not only the classroom. Can you create different spaces, multiple sites in school, non-homogeneous space for different parts of school to be meaningful for the different diverse needs of your student demographic?
Danny. And no other indications online. So, David.
Thanks very much, Chair. And I'm not going to draw you into the politics of academic selection, other than to say that I'm very much on the other side of the fence from Danny on that one, but not going to go down that route.
On a lot of issues.
Yeah, on a lot of issues. In terms of the bullying, I'm not going to ask a question about bullying, but I think it's been really interesting to hear that issue again grappled with today. I think even anecdotally, I think we all probably know people who've suffered bullying, particularly in their childhoods, whose character and life thereafter have been shaped by that sort of experience at a very early age. So I think it is something we need to grapple with. I was interested in the point you raised around sleep loss and sleep health, and the idea of, I thought it was an interesting idea about sort of the kids keeping a sort of sleep diary and maybe sort of being able to self-analyse, is this a good thing, is it a bad thing? Has there been any work that you're aware of done on that, particularly in the modern era, and what are the leading causes of sort of bad sleep health? I'm thinking of like screen time, but equally some of those family issues that you've talked to might be there as well. But perhaps you're more aware than I am.
No, that's a good point. Yeah, so there is research there to point out that electronic devices, issues like that are making young people struggle to go to sleep. The pandemic has not helped in terms of breaking patterns of sleep. But you're right to point out that there's also a cohort of students who may not be sleeping because they're too stressed. The one that I pointed out before when I was arguing for school hot meals in a Southern Irish context was I'm pointing out that it's much more developed here than it was in the South. Is that hunger can be an issue stopping people sleeping as well. But so again, it's a behaviour of which there are many different motivations. So we need to address the different ones. So from one of our studies, as emphasised, it's the student ownership over it. If you tell students to go to bed early, they'll probably go to bed later. And we had a recent study where a nurse in school was in some way trying to develop a programme on awareness of sleep in a primary school setting of high poverty, and to be blunt, the pupils reacted the other way, okay, and they were actually going to sleep later. Okay. Now this is actually a well-known phenomenon in health that if you tell someone to do something, and there are certain from later primary onwards, the odds are they're not going to do it. They're going to do the opposite. So there are ways in which you develop skilled approaches. But my point here is that teachers are actually very well equipped with their teaching methods to develop that part, and that part is not an expensive public policy initiative, that does not need the outside professional coming into the classroom. Now you may have a bit maybe for a nurse or someone else to talk to with some parents about. You have a parental dimension there that was in our first study, but the ownership of the process, the diaries, all of that is led by the class teacher. So I think with not huge proportionality principle here, that is a low hanging fruit. You can make a big change in people's lives by making them aware that it doesn't help them if they're feeling wrecked coming into school because they've been sleeping. But I just to reiterate the point that it seems to be easier to make the argument on a school day for them not to go to sleep, or to go to sleep earlier than on a weekend. Yeah. That's a more entrenched one.
Yeah, I appreciate that. I think it's an interesting point to be explored. Another point, and I don't want to be perceived as coming from a particular direction this, because I find some of it interesting to be explored, but certainly I can see the arguments against sort of the expulsion, suspension and all of that. I guess what I'd be interested to explore is, I heard you talking about just authoritarian teaching and so on. I'm just wondering how much your views on expulsion and suspension then apply to other sanctions, detentions. How would you see some of the sort of sanctions that teachers may wish to use in their arsenal, you know, how would you view that? How the appropriate use of that, or what way do you think that teaching needs to be adapted in that way? I'm just thinking that teachers will start to feel probably under pressure as to, you know, what can we use if it is going to be, you know, counselling will have an answer for some of those issues, but it won't be an answer for everything.
It's a good question. I remember a principal in a school in Kosovo once said to me, Paul, we're not paid enough to be nice to the students, okay, and our salaries aren't high enough. And the answer back I gave him was that the medical injunction, primum non nocere, first do no harm. So you as any professional, you have at least the basic status of not harming the people you're working with. So the first one I would say is take anger out of it. Okay, so you want to start. You need to teachers need to have other communicative skills than communicating through anger. Okay, and I've seen teachers screaming in the faces of youngsters over the years in schools, and it's just a poor communicative practice. You wouldn't expect a nurse in a hospital or a doctor to go shouting at a patient. Okay, so there are certain kind of communicative strategies that you want to phase out, not just phase out, eliminate quickly. Okay, so anger-based approaches is one. The other then, you know, would be about what kinds of alternatives. I'm particularly focused on the suspension one and the reduced timetable because that's removing them from school. Your one is giving them more school, okay, in detention.
Yeah, that's sort of.
My focus there would be try to give them meaningful activities, rather than just ones that are purely for punishment. You know, does the punishment really? It's just going to make them maybe hate school more. Whereas you want to find ones which will help them, you know, behaviour contracts where you're trying to develop, involving them in designing solutions to their behaviours, but they're not just conglomerations of behaviours to students, they also have emotions and thoughts that need to be engaged with. So I think their ownership over that process would be an important part of that. But to be very clear, I do think reduced timetables and suspensions, expulsions are very, very detrimental to the mental health, educational well-being. Detentions is nothing like the same scale of damage.
Oh, I can understand that. I don't think it'd be too far from anything that you've said there, but I just wondered how that expanded to other sanctions and so on. But I appreciate that explanation. Expand then, and probably related to that, then you talked about the driving committees around that and sort of democratisation almost of it within schools. I'm not sure I fully grasped what exactly that was in terms of pupil involvement. You said about a teacher leading it, but it almost sounded at some stage, and I could have got this wrong, almost about how if a teacher being too authoritarian, are you talking about they could be called to that committee, or what does this look like? It sounds like CAF Student Council,
Time's very nearly going to beat us here, so if I'd ask you it's possible on this one to draw to a close.
I think some of that is for the local circumstance of the school, for who would be on the committee, but it would need to be meaningful that students' voices would be part of it, and but the broad parameters would be wide inclusion issues such as bullying, you know, supportive atmospheres in school, inclusion, you know, avoiding loneliness. So how you create a broad culture of inclusion, and you involve all the stakeholders as you would for any initiative. All the stakeholders, and it could involve some parents, but I think it's more than just a student council idea. It would probably include, you know, anonymous surveys of pupils, students. There's ways in which you want to make it meaningful. It has to address some problems in the school, and then work on pathways, maybe not alone in the pathways for solutions.
Because we have a clear idea. Thank you. Thanks, Chair.
Thank you, David. And look, just on behalf of the committee, I want to extend our thanks for that really wide-ranging and really, really informative briefing today. And we really do appreciate the time you've taken us to go through so many of those interconnected issues. So thank you.
Thank you so much, and stay
in touch.
Okay.
Okay, I'm going to propose a short comfort break, and I think in terms of any actions arising, it probably makes sense to conclude the two briefings on the issue, and then we can take those forward. Okay, so if we could just turn off the live feed there. Sorry, members, that's us back in open session. That means the live feed is on. So we're on to item 8 on the agenda, and that is further oral briefing on the theme of deprivation and underachievement. And if we can bring the witness through, we also have a witness who will be joining us online. So I would draw members' attention to the briefing note from the committee clerk at page 231 and a briefing note from the ESRI at page 3 of the table papers. So joining us today, we have Dr. Anne Devlin from the Economic and Social Research Institute, and also joining us remotely, hopefully coming online, we have Professor Selena McCoy, the Adjunct Professor of Sociology at the Economic and Social Research Institute. So you are both very welcome here today. The purpose of the session is to reflect on the question of links between socio-economic disadvantage and educational underachievement, and hopefully the opportunity to do some cross-jurisdictional and best practice comparisons. But at this stage, I will hand over. I'm not sure whether which of you is going to lead any initial presentation, but would ask for opening remarks of up to 10 minutes, and then we'll move into question and answer. And to ensure that we're fairly tight on time, we'll look to keep it sort of to 5 minutes per inquiry from each member for at that stage. But I'll hand over to yourselves.
That's great. Thank you very much, Chair, and hi everybody. I'm Anne Devlin. I'm an economist at the Economic and Social Research Institute in Dublin. That's always a mouthful. I know it's hard to tell, but I'm actually from the north. You might not have noticed with the accent or anything. And then I'm joined today by my colleague online, Professor Selena McCoy, as the Chair said, who leads the education research within the Institute. So you're getting the E and the S of the ESRI today. So you've got a written submission. I'm just going to go through it briefly. There might be a couple of things that have been added in since it was sent over to the clerk. I'm going to begin by highlighting some key evidence on educational disadvantage in Ireland, drawing in particular on the Growing Up in Ireland study, as well as a number of recent research projects, most of which are the remit of Selena and her team, before moving on to comparative research, particularly a study comparing education systems north and south, which we published in 2022, which was work by me and my colleagues in the Institute. Growing Up in Ireland, or GUI as we call it, is the National Longitudinal Study of Children, which has provided important insights into educational experiences and gaps between social groups in the Republic of Ireland and the processes and factors underpinning those gaps. As well as the research output using GUI, I think the data set in itself is notable to the committee and maybe worth something maybe we'll come to talk about. Moving to the research, the first focuses on early educational development, examining how parents' approach to learning at home and children's exposure to early childhood education and care shapes differences in reading ability. The evidence shows that both children's gender and their family's social class influence their cognitive development between ages 3 and 9. Parental reading, participation in early childhood education and care, and longer time at school were all found to facilitate language development and partly explain differences in reading scores age 9, although strong direct impacts of social class remained even after controlling for other things. While previous research indicates parental academic expectations and students' self-concepts contribute to the link between low socioeconomic status and low educational attainment, few studies have examined socio-economic differences in the temporal changes of these constructs across the school years. Our research provides new insights into the role of academic self-concepts, parental expectations, and teacher-child interactions in the development of socio-economic status differences in educational attainment. The results show that bolstering children's academic self-concepts prior to the secondary school transition, curbing steeper declines among socio-economically disadvantaged children, and encouraging parental education expectations could reap significant long-term rewards for young people's educational attainment. Teacher-child interactions moderate parental expectations and are a particularly salient influence for socio-economically disadvantaged children and those with low parental expectations. A recent study on schools in the voluntary secondary sector in Ireland provides valuable insights into student experiences across diverse school settings and the role of school social mix in shaping student experience. The study highlights wide diversity across school categories in terms of social mix and student need. For example, among the DESH schools that you've been hearing about today already, participating in the study, the proportion of students identifying with SEN ranged from 8% in one school to 40% in another, so quite a stark difference. Students attending DESH schools were found to benefit in terms of curricular provision, the strong emphasis on literacy skills, opportunities to participate in sports, particularly for girls, their role in decision making, and the nature of their interaction with their teachers. Stakeholders appreciate the role of the additional resources received through the DESH programme in enabling schools to meaningfully support students, for example through the homeschool community liaison officers that Paul was talking about, but also the school completion programme and breakfast clubs. These supports have become even more critical in the context of rising school absences post-COVID-19. The Department of Children figures show noticeable differences between DESH and non-DESH schools in terms of absences. Also at secondary level, there's been research recently on the grinds system in Ireland, so the shadow education and the growing student participation in that, particularly in terms of the impacts of the widening inequality in educational attainment that will lead to. While 60% of final year students engage in such tuition, there are wide social differentials in participation, not just in terms of social class, but also as a product of motivation and expectation of the students and their parents. Students highlight how the grinds culture has become normalised, an accepted component of exam success for many students, but family resources shape access to that. Finally, a body of work has been examining intersectionality and educational disadvantage and gaining an understanding into how disability and socio-economic factors, particularly family resources and school context, shape school and post-school educational outcomes. The evidence reveals multiple challenges facing young people with disabilities in Ireland, in particular reflecting the direct and indirect impact of socio-economic disadvantage at family, school and community level. All else being equal, children who are identified with a socio-emotional or behavioural difficulty are less likely to progress to higher education in Ireland. The results again highlight the importance of attendance, engagement and achievement during primary and early secondary years and of parental expectations for later outcomes, raising important implications for inclusive education and policy addressing educational disadvantage. The evidence shows the clustering of students with complex needs in DEIS schools and in economically vulnerable households and the significance of these factors in students' post-school pathways. While the DEIS programme has shown strong results in tackling gaps in achievement, attendance and engagement, adequately supporting the complexity of needs that their students are facing demands more resources and is an issue for some of the schools. Two challenges in particular emerge from the research. Schools serving disadvantaged communities that are not part of the DEIS programme struggle to meet high levels of need. Essentially, the programme as it currently stands is not sufficiently responsive to address the changing needs that schools are facing. A second, perhaps larger problem relates to the capacity of schools to meet growing student and community need, particularly in a context of funding shortfall for schools. School leaders and wider stakeholders ask the question, how much can schools realistically do? Plans for a DEIS Plus category, providing enhanced resources to the most deprived communities in Ireland, are very much welcome given the evidence so far. Alongside DEIS Plus, the ESRI have also recently commenced work on developing a monitoring and evaluation framework of the DEIS programme and to identify where changes in policy and resource allocation might be required. Turning then to the comparative research. So in 2021-2022, we undertook a mixed method study on the education and training systems for primary right through to third level in Ireland and Northern Ireland, which offered much insight into the nature of the two systems and the similarities and differences between the two. The study found sizable differences in educational attainment between Ireland and the North, which persist even when the underlying demographic differences were taken into account. The proportion of the population in both jurisdictions with the lowest levels of education was similar in 2005, but by the time we looked at data, sort of early 2020 essentially, so 15 years, it fell to a much greater degree in Ireland than we've seen in the North. The North had fell only marginally over that time, so real divergence between the two. In terms of early school leaving, the real noticeable differences there too, with it being dependent on the different definitions we can use, about 2 to 3 times higher in Northern Ireland than it is in the Republic. These improvements and better outcomes in the sort of 15 years up to that point were in part explained by the DEIS programme. The study finds pronounced barriers for students from socially disadvantaged backgrounds in both jurisdictions, with students from socio-disadvantaged backgrounds having poorer exam grades at secondary level compared to their peers from more advantaged backgrounds, with wider inequality in exam grades found in Ireland. However, we believe this is reflective of the early school leaving then feeding through. Expectations of going on to higher education also vary considerably by students' social profile in both jurisdictions, with lower expectations found among those from working class backgrounds. Further education is commonly perceived in the North and South as a second best option. I think one person we spoke to talked about Cinderella status compared to higher education. However, it did feel in qualitative work that this was more important, more apparent in Northern Ireland. There are also ongoing changes in policy in Ireland at the minute to resolve this, so bringing the further education applications into the CAO process, which was typically for HE applications. Important differences also occur across the two systems in terms of post-school opportunities provided. In particular, stakeholders in Northern Ireland emphasised the challenges of having a multiplicity of providers and duplication of courses. So we're seeing post-secondary vocational options being offered typically in FE, but then also now in HE in schools, and then A-levels, which were traditionally the remit of schools, being offered in FE as well. To address the educational attainment gap and facilitate more meaningful progression routes, we argued for the need to show the value of taking further education courses for young people and to ensure clarity around pathways from school, from secondary education into further education, or from further education into higher education, if that is the sort of routes children and young people wanted to go down. The study also found similar findings to those already mentioned today about DESH and the findings from the Ireland-specific work. Many stakeholders we spoke to in the Republic spoke highly of the DESH programme and the benefits it brought. And as above, this was particularly in the form of the homeschool community liaison officers, breakfast clubs, and really just the holistic wraparound approach that the DESH programme took. Interestingly, many of the stakeholders in Northern Ireland also brought up the DESH programme. They were very aware of what was going on south of the border. In terms of funding for educational disadvantage in the north, many teachers found that as the money wasn't ring-fenced, it wasn't always going to support disadvantage given the issues and the financial constraints and emergencies that schools were sometimes dealing with. And I suppose that reiterates what was found by the Northern Ireland Audit Office report some time ago. In follow-up work, we examined the intergenerational transmission of education in Ireland and Northern Ireland, which was published in 2023. And we found that the marginal effect of the impact of low parental education on the probability of a child having a poor educational outcome was about twice as large in Northern Ireland as was the case in Ireland. In terms of educational mobility, 38% of young people in Ireland exceeded their parents' level of education compared to 29% in the north. It's probable that academic selection in Northern Ireland and the economic cost and social inequality associated with the selection system and also the segregation more broadly is a contributory factor limiting the extent to which the educational system in Northern Ireland facilitates intergenerational educational and then down the line earnings mobility. Just on data, and this wasn't in the written submission, it's worth noting there is considerably less research in Northern Ireland than there is in the south looking at specifics of the education system. And this is for a variety of reasons, but one is the lack of data, and this is something we bring up regardless of what area we're looking at this stage. We're particularly concerned about recent developments in data infrastructure, which will make this even more problematic. So divergence, as the UK is no longer going to be in EU data sets, and also the North, for example, didn't take part in the recent round of the PIAC survey because, I believe, of financial limitations, which is a study we used in that 2022 report and was very useful. However, I do note that the longitudinal education's outcome database is due next year, which I think is very exciting, if that's the right word. And then just briefly on a sort of higher level, at EU level, an expert group on quality investment in education and training assessed approaches to equity and inclusion across the UK. The evidence shows that education systems that aim at reducing inequality in students' learning conditions are also the ones that get better academic results and improve students' well-being. Given that socio-economic inequalities in cognitive and socio-emotional development emerge early in life, early interventions are key. And I suppose we all know that from the Fair Start report. School segregation is a second critical dimension of education inequality. Education systems with more school segregation reduce the opportunities of pupils from lower socio-economic backgrounds. Priority education policies, like Ireland's DESH programme, take various forms across Europe. Overall, they have positive effects, and even if they require considerable investment. So, thank you.
Thank you for your presentation. Look, I'll just get straight to my questions as time is against us here. Look, your paper highlights, and we covered this in the last session, that academic selection could have an impact on educational outcomes and on that intergenerational educational and earnings mobility that you referenced. Can you expand on why you've made that link and what the potential linkages are between academic selection and the educational mobility?
Well, I suppose Paul maybe talked about some of the more holistic nature of it. One thing that came up in our report very clearly was when we were talking to stakeholders from the north, and I think this is very much a growing problem, is the increase in special educational needs and how that is sort of mixing now with academic selection, in that it's all essentially, for the large part, being funneled into secondary schools. Secondary schools, we know the funding, and you know all about the funding shortfalls, the issues they're facing. And then now, essentially, with the increase in special educational needs, this is perhaps just increasing challenges for schools. You know, teachers were sort of saying they're dealing with too much. We know that. And really, just that the secondary schools in particular are dealing with socio-economic disadvantage and SEN, and really it's compounding within that. In terms of I still want to call it the 11 plus to show my age. In terms of the academic selection at that point, at 10 or 11, I think we obviously know affluence had an impact even when it was the 11 plus. Now that we've moved away from that system and it's dependent upon the schools, which aren't supposed to be preparing for it, perhaps are, it wouldn't be my place to comment on that. It really, children and families are then dependent on the private tuition. You know, we've seen what the Grinds system is doing in Ireland. It's exacerbating social inequalities, and really I think it's highly likely that's the case here. I think it's very hard to do research on this, but I think it's something that I actually might be able to do robust research on with the longitudinal data set next year, so it'll be interesting to see. Selena might want to come in from her work in Ireland that's similar, you know, on different types of selection.
Very, very good points there, Anne. I guess it's a more complex picture in a way because, you know, we had a lot of subtle selection processes going on in Ireland for a long time, particularly in the whole area of special educational needs. So schools were saying that they really didn't have the supports and the systems in place to meet certain types of need, and by consequence, they were turning people away. Now, that appears to have declined in recent years with the Admission to School Act and all of the recent legislation. It does seem to have declined, but there probably are still subtle practices going on. And there certainly is the case as well. So Anne has mentioned that the DESH profile varies enormously. So for example, that students with special educational needs range from 8% in one school, in one DESH school, to 40% in another. And that was just 7 schools we studied in that study. So some schools, by virtue of being very effective and very inclusive in their methodologies and in their approaches and in their climates, as a consequence, attract a large number of students with additional needs, of very diverse different additional needs, sometimes complex needs. And by virtue of that, they end up having a population of students presenting with very complex needs, and they don't receive the disproportionate resources to meet those needs, to be fair. So I think there's a lot of issues, and hopefully we can come to it in a moment, but there's a lot of issues over how resources are targeted at schools meeting complex needs in Ireland. The DESH programme being the critical one, really, but the effectiveness of that programme in meeting complex needs. So, I mean, I can keep talking, but I mean, we might come back to just how the programme is targeting, and a couple of gaps there, and the need for better indicators and the more responsive and dynamic approach. I probably won't talk too much about it now, but it's certainly something.
We may come back to that, and I suppose I'll just make one final question on the selection issue, and then maybe just very briefly on how we target resources. In terms of tackling educational underachievement, would you suggest from your research that looking at academic selection is something that the department should be doing? And I'm genuinely, I know we went down quite a political route last time, but in terms of the committee trying to understand what the appropriate interventions are, is that something in terms of what your research has shown that could potentially be an area for attention?
Yeah, well, we very much, the stakeholders we spoke to, you know what, it's not us, it's the stakeholders we spoke to in Northern Ireland who came, teachers, principals, you know, a whole range of backgrounds across the north, very much felt that it wasn't helpful. And I think we have some of the, like Professor Tony Gallagher is one of the experts in this area in the world, not just here, and has done lots of research in this area.
That's helpful. Look, I'll ask a question, probably just for a brief answer, because I know other members will be keen to come in. We've had investment from the department and from the Shared Island Fund, which has been funnelled into the RAISE programme here. And from our understanding of it at the moment, it's looking at different sort of place-based interventions that are largely looking at pilots, trials, testing in terms of what works well. In terms of trying to tackle educational underachievement, you have a model there with the DESH schools of very targeted investment into specific schools. If there's a pot of money to be invested, would you be suggesting from your research that piloting and trialling different approaches is a helpful intervention, or is getting the money into schools with specific interventions such as we've seen in DESH schools, what is more likely to be effective? And I'm happy to think in the longer term, you know, if the pilots do deliver information that could inform future practice.
Just briefly, in my opinion, we have a very, you know, the stakeholders in the north talked much more positively about DESH than some in the south, because obviously they're in it. You know, a lot of them said they wanted more resources, they wanted more schools in, of course. A lot of people across the north here spoke about the DESH programme and spoke about it with envy. I think it's really interesting to see the move with the RAISE programme. To me, there's been a lot of reports about socioeconomic disadvantage. A Fair Start is brilliant and was very important, but it's not the first time we've learned all of this. You know, there's been reports for a considerable period now. I would be of the opinion that we need to get moving. We don't have huge financial resources here. The government, the executive could change. I think consistency is very important. Getting money is important. But Selena will maybe add briefly to that.
Yeah, no, really good, Anne. So just to say briefly, the evidence on DESH is fantastic. I would kind of contest Paul a little bit on this, or Professor Downs. So we did a study last year, 21 deep dive in 21 schools, 7 DESH, 7 socially mixed, and then some fee charging schools. The DESH students came out very strongly across a whole range of dimensions, including things like their literacy, their emphasis on literacy, their reading, their opportunities to engage in extracurricular activities, particularly sports, particularly for girls, which tend to be much less likely to participate in sports, their role in decision making, democracy in school, the school climate, the relationship with the teachers, the positivity in which they relate with their teachers. All of those things were really strong for students in DESH schools. So the DESH programme is definitely having a very profound impact, and the evidence is really strong, I think, on this, that DESH schools are definitely doing a lot to make school a place where students want to attend. And students with all sorts of disadvantage, they want to attend for all these reasons around extracurricular teaching and learning methodologies, their voice in school, how they're treated by their teachers, and all of those things. So I just want to get that on the record first, because I think there's a lot of really good evidence there, and I don't think we should be just throwing that out. So the DESH programme is really, really good. However, there's room for improvement, and there always is. And I think, so 2 things I would highlight in terms of where we need to go with the DESH programme is, and one is, and probably the most important one, is this DESH Push Plus issue. The schools with the most complex needs in very deprived areas, typically inner city areas, definitely need more support. And so, and Paul has talked really well about this, schools reporting really severe cases of intergenerational poverty, trauma linked to care, homelessness, mental health issues, substance abuse, all of those issues, profound impact, and schools are really struggling to meet all of those needs effectively, as well as all the learning needs of their student body. So there's definitely a very strong argument for this DESH Plus, a subcategory of schools which receive much more intensive resources and more of the wraparound specialised supports as well that Paul has talked about. So I would include there the social care workers, the speech and language therapy, psychology, but homeschool liaison has been fantastic. So I think more of that for sure. Homeschool liaison has been instrumental in making those connections between schools and parents, and to create that involvement and that ownership and that interest in their child's learning, you know, and the supports for those families in terms of parenting skills and wider kind of service supports related to health supports and everything else. So I think the connection piece is really, really important. So there is room for improvement. The other issue around DESH is there's very hard cutoffs. So at second level, you're either in or you're out. It's a binary system. And lots of schools have changing enrollments very, very quickly, and the system doesn't respond very quickly. So it's based largely on census data every 5 years. And of course, a school's profile can change in 2 or 3 years very dramatically. So if we can create a more responsive and dynamic identification of schools, I think the DESH programme is fantastic. And I hope I'm not unique in thinking that in Ireland, but like there's a lot of research to show a lot of positive effects, and it's a good programme.
That's
Yeah.
really helpful. I wonder, just to finish on my points, would it be possible for you to, I think, for the committee to share, any of that sort of information that we could look at, outside of the meeting space, in terms of just a background to the history of the DESH programme, the research that's been done in terms of, assessing its impacts and effectiveness? That would be really helpful, I think, for members to see. Okay, I'll bring in the Deputy Chair now.
Thanks, Chair. Thank you, Anne, for your presentation, and Selena also. I wanted to go back to the RAISE programme, who got the funding came from the Shared Island Fund, €24 million. Unusually, the Minister has devised a very sort of complex and convoluted way of allocating that funding, and hasn't given any extra weight to poverty, socioeconomic deprivation. Now, we've heard a lot today, Selena mentioned it and Paul mentioned it beforehand, about other factors that may be involved in educational underachievement and early school leaving. But from what I have learned in my role in this committee, socioeconomic deprivation is still the best predictor of a child's educational outcome. Would that be true?
Yes, that would be true. We know there's gender differences, we know there's religious differences, but it's very clear. There's numerous tables in the Fair Start report. It's very clear that socioeconomic difference is the main driver of it. And I suppose you can measure that however many ways, but it's fairly consistent and it's found in lots and lots of places.
And therefore, if an education minister in the South had said, when the DESH programme was being established, had said, well, we don't want all this funding or most of the funding going into inner cities, where most of the deprivation is, but we want to spread it out geographically. Would that make sense to you?
Thankfully, I did my homework on this committee.
This is very wise, Anne, very wise.
I wasn't actually expecting all the questions in academic selection. Do you know what? When the RAISE programme was first announced, and I'll tell this very honestly because it's the only way I know how to do things, I think I heard about it. I was in the car, it came on the radio. I says, brilliant, following our 2022 report, great to hear. This is exactly why I went to work in the Institute, to be working on policy relevant issues. So I went home to look up what was the crack with RAISE and what was going on. And I think one of the first things I came across was the list of schools, which immediately I was shocked by and really didn't understand. I went to a grammar school in Ballymena, which I won't name given the backlash that followed the list of schools, and was surprised that it was quite near the top of the list. But I know now, I don't know what's happened. There's been a bit more clarity maybe since about how exactly RAISE areas that they are and not particular schools have been formulated. I know there's been a movement away from free school meals, and to be honest, I think there's probably pros and cons to that. You have talked about it loads here before. This is not news to anybody. Free school meals is a very crude measure of deprivation, but it's annual, it does the job. I know the Minister, there's 7 or so criteria. They probably all are very heavily correlated with free school meals, I would imagine, if you looked at the data. My concern around some of them would be the likes of the GCSE attainment. As Selena said, one of the issues with DESH is it's being done every 5 years on census. If you're waiting for children to get the full way through till year 12, then you're waiting on the GCSE data results to come out, and then the data to come out a year later before you make any pivot to RAISE. That's where my questions would be in terms of that time lag, given the importance we know on early interventions. In terms of the criteria and the method that's got to, I do think there's probably a lot of correlation between them metrics if you were looking at the data. In terms of the regional spread, it's unclear from the methodology and so forth online about how that's done. You know, do you pull Belfast and Derry out and then take the next, or is it just on an LGD basis? I wasn't entirely sure looking at it, so I wouldn't comment. I went to school in Ballymena. I now live in East Tyrone. So I think some of these things, there's personal and there's political decisions to be made about where funding goes. We don't have a magic money tree. I personally would be supporting that it's spread across the north, especially given the economy and all other departments. You know, we talk a lot now about regional balancing and looking sort of west to the Ban. So.
Fair enough. I mean, I suppose
Selena maybe just wants to come in.
Yeah, I might
Sorry.
just add to that. So yeah, I mean, excellent answer, Anne. Fantastic. But I just want to add. So this is a topic of scrutiny at the moment in Ireland. So I've just signed a contract just this week with the Department of Education to develop a monitoring and evaluation framework, particularly around debt. So the objective of this research program of the next 12 months will be to get a more responsive and effective identification of need within and across schools. So how is socioeconomic disadvantage best measured? What sort of variables do we need? Which sources of data do we need? Can we use existing data? Is that enough? Can we improve existing data sources like the pupil database, the post-primary pupil database? And, you know, or do we need additional data sources to best measure need and socioeconomic deprivation in particular? And all with a view to kind of shaping resource allocation and the effectiveness of that allocation and an ongoing refinement and measurement, capturing that evolving school need. Because in every jurisdiction, schools' needs evolve very quickly in some cases. And so it needs to be a very dynamic, responsive system. So that's something I'll be working on over the next 12 months. I'm just flagging it because I think it could be very relevant to your deliberations.
Yeah, thanks for that, Selena. And just to come back in on the sort of area-based way that this funding is being allocated, the difficulty is, and everyone would like to see funding as widespread as possible, but you know, in my view, it would have to be based on objective need, and as things stand, you know, the most acute objective need is probably in the inner cities in Belfast and Derry. But I'll leave it there. I wanted to move on since you're an economist, Anne.
Can I just briefly say one wee thing? Our deprivation measures maybe aren't urban and or rural deprivation are very different, and maybe aren't great at necessarily always getting at rural I don't disagree by any means that it is in the inner city areas, but I think there very much is a lot of deprivation within rural areas, occasionally very spread out, and it's something worth thinking about. But again, there's no magic data or even economist way of sorting that, you know.
Absolutely, and I agree with that.
Need to be a very, very brief final question and a very brief answer.
Since you're an economist, I think you said here in the north, the education department receives 19.4% of the overall budget, and probably by the time monitoring rounds are handed out also, it probably brings it close to 20%. How does that compare with other jurisdictions in terms of budgetary allocation and also in terms of educational outcomes?
I'm very happy to follow up. Selena will maybe know offhand. I think when we did the report, per capita spend, I do think is lower here. But I'm happy to follow up with that with some figures. I don't know them all off the top of my head.
And I see you shaking your head.
That's grand. Well, if you could follow up, that'd be great. Yeah.
Yep.
No problem. Thanks.
Great, thank you. Kathy, you'd indicated next.
Thanks very much, Chair. And apologies, I'm not there to ask you this in person, but I wanted to touch on the concept of early intervention, and we hear this time and again, especially around special educational needs, but I suppose specifically as well around educational outcomes. You know, you'll be well over the detail. You'll know that we do have a difficulty here with the statement process in the north. And I'm just asking because we're waiting at the minute on the childcare, but specifically the early learning strategy here. And I was just wondering, you know, do you have any ideas or views as what provisions should be within that strategy to try and make sure that every child gets the very best start on their educational journey and maybe have better outcomes towards the end?
Yeah,
I haven't
Selena.
done a huge amount of work on the early years. Most of my work is at primary and second level, but certainly colleagues in the ESRI have, and we could certainly send on some papers on that. Fran McGinnity in particular and Helen Russell have done a lot on early years and the value of particular types of interventions and the effectiveness of different in terms of the longer term outcomes. So we'll happily share those. Yeah.
Brilliant, that's great. Then the other sort of area that I have a question around, it relates to Irish medium, and in particular around the assessment. And look, we know around Irish medium that many of these schools are placed within areas of disadvantage. And of course, given the discussion that we're having today, it's fully recognised that the nature and aim of any assessment requires, very careful consideration in both jurisdictions. But I'm just mindful of the, I suppose, growth that we are seeing in Irish medium across the island, but specifically here. Would you share the concern that we've now, it's probably over 50 years since we've seen the very first IME school here, and the sector still, it's lobbying across the board around not having appropriate access to assessment tools, for assessments to sort of determine what pupil attainment would be. Do you have any view on that?
And I don't know if you want to come in there. It's not something we have looked at in the Institute, and it's not something that really has received enough attention in Ireland either. So there has been somewhat of a proliferation in Irish medium schools, but not at the same rate, I think, as Northern Ireland, as far as I know. I think at a much slower rate. And I think some of the critical issues there around teaching and learning resources and books and all of that, I think there are issues around that. In terms of assessment, I don't know. I mean, I think there are issues, but it's not something that we have done any research on or has received much attention, to be honest, in the Irish context, as far as I know anyway.
Yeah, I would agree with that. And I think, as you said, it is interesting, given the growth and given the relationship with deprivation. I suppose more on an anecdotal note, what you do see, or where there maybe are communities around these schools and stuff, it's very ad hoc and based on individual people, and that seems to be how a lot of the education or that sector is driven, by people who feel very strongly about it. The likes of Anne Carn and Mahara, which obviously the school, there's a shop with a big community resources, and I think they've several books out now that they're selling within the shop because they just weren't available. But again, it's all sort of ad hoc and people based, really.
And actually, sorry, there was one piece of work we did, gosh, it's back in 2004, so it's quite dated. But we did a study looking at who went to college in 2004, I think was the title of it. And we looked at how that varies. We looked at school leavers from all different sectors in the system and their rates of progression into higher education. And actually, they were really high for the Irish medium schools. They were on a par with the fee charging sector. So they actually appear to be very selective in their intake and very much middle class settings at that time, at least. Now, the growth and provision, maybe that's changed, but they seem to be more on the more middle class end than a more deprived end. That was the evidence at that time. That's the only research I have on that. Yeah.
And that was in the south?
Yeah.
Yeah. Okay.
That base next year would maybe facilitate research into specific sectors a bit better and long-term pathways for the pupils going through them.
Yeah, no, that would be, because like I say, it's something that's brought up time and again. It's the struggle within the Irish medium sector in terms of resources and, even assessments and having to translate from English to Irish to mark assessments and things like that, which just doesn't work. And you hit the nail on the head where it's the sector that's doing the heavy lifting, that's doing the growth, and it's because of them it's as successful as it is, because despite the department having the statutory duty, to support the sector, it doesn't seem to be the case. But thanks for that, and I would appreciate that research in terms of the early years as well. Be really interesting.
No problem.
Thanks, Chair.
Thank you, Kathy. Cara, you'd indicated next.
Thank you, Chair. Thank you so much for being here today and for your briefing. Just to ask there about, we talk a lot at committee about the delays in getting assessments for ADHD and autism in our young people. And I suppose this ties in the socio-economic factors of middle class parents will be able to afford to get a private diagnosis, while other children are forced to sort of wait in a queue that can take years. Is there anything that's a huge barrier to access and education? Is there anything in the south that they're doing that we should be looking at here to ensure that children who are awaiting a diagnosis get the proper adequate support and get the best educational outcomes possible?
Absolutely, it's definitely a big problem here. Stine, I don't know if you've worked on that or.
Yeah, I have. So yeah, but probably the biggest issue I would say in the south at the moment is accessing specialised supports and assessments. They're the two critical issues, and there's constant lobbying going on. in terms of the kind of advocacy groups and parent groups trying to support their children. For me, I don't think it's improved enormously over the last few years. It was exacerbated in the context of the pandemic. So we had this brilliant vision that we would have a school inclusion model. I don't know if you've heard about that, but there's a school inclusion model planned to start just as the pandemic broke. And the idea of that was that there would be specialised supports within school context. So you'd have speech and language, psychological supports, occupational therapy, and a whole suite of supports, and far more in the way of NEPS, National Educational Psychological Service, the assessments they provide, and that they would be kind of wraparound and would support ultimately a move towards full inclusion. By full inclusion, everybody attending a mainstream school. Now, the pandemic happened, and nursing supports as well would also be brought into mainstream schools. When the pandemic broke, obviously none of that became realistic. Recruiting any of those people to work in schools became impossible. And that programme broke down, and we have been actually commissioned to do a pre-post analysis impact study, which obviously never happened. So I think that model that was being designed was very promising. In the sense that you bring all these wraparound supports into a mainstream school context, and then you reduce the need for students to go to specialised, segregated settings. It's happened in a few countries quite successfully, but there are challenges, and obviously it's a really complex thing to do, and it requires massive resources, to be fair. So I think that's one certain model there in terms of kind of providing those specialised supports in a mainstream context. I guess where we've gone since then and over the last 10 years is probably a move towards, I think, more segregation than inclusion. So I did a study 10 years ago now to look at how students in special class settings within mainstream schools, how they fared. And the study was longitudinal and looked at different types of special class settings for different types of need, physical need, learning need, and so on. And the study was actually quite disappointing in the sense that it showed that these operated as a form of segregation. The students tended to go into these settings at the start of primary or second level education and stay there. There wasn't the movement and the fluidity that had been envisaged in policy documents around this. So they stayed together as a group. They typically, 60% of those special classes at second level were taught by one teacher for all their subject areas, which is quite astounding. So obviously their capacity to progress was seriously impeded, but more importantly, their interaction with their peers was very much impeded. So they operated as a form of segregation. So the study at the time was so we did a full census of all schools as part of the study. It was a massive study. It was quite damning in terms of special class provision. There's been a massive proliferation in special class provision since that point. 1,700 new special classes in the last couple of years alone. That is the policy response in Ireland to meeting specialised and particularly more complex needs in a mainstream context. But I'm not convinced it's the best one. So I actually don't know what the situation is in Northern Ireland, if there is special classes and how they operate. I should have looked into Northern Ireland at the time, but
similar picture.
But it's certainly
very similar picture. Yeah.
Okay, so I've a lot of concern about this policy direction and about just particularly in relation to autism classes. So a lot of the new classes are designated specifically for autism. The incidence of autism in Ireland, and I think in Northern Ireland as well, has risen from 1.5% to 5% in the space of 3 years. So I think we need to do a lot more in terms of looking into how to meet the needs of these students in an inclusive way. And I'm not sure the special class model it solves all the problems there.
Brilliant. Thank you so much for such a detailed answer.
Time is going to beat us here,
Yeah,
Cara,
I was just going to say, in the interest of time, I had two questions,
yeah.
but I'll wrap them into one. Just talking about the reading up on the low parental education, the impact that has on the child, often resulting in lower education for the child. Can I ask, what aspects of the South, like on this matter, what can we learn from them? And in the previous session, we had talked about physical disability being a barrier to education. Is that something that you're seeing as well in the South, in school settings?
That's something, the disability in particular, is something some of the education team have been working on more recently. In terms of the parental education, I suppose why that link has been broken to some extent, or at least lessened. It's not perfect. Again, it's probably just coming down to the things we've talked about: academic selection, remaining here, and the DESH programme. You know, at the end of the day, mother's parental education is just another way of essentially, you know, it correlates very highly with deprivation and socioeconomic disadvantage. And then, you know, even things like if the mother's got a degree, is there more likely to be books in the home? You know, how they then view the value, you know, all the sort of things we talked about there, and how that impacts on the child. But Selena will maybe speak more specifically about the disability.
Yeah, no, the growing up in Ireland has
You
been
know, I'll have to just ask for a really brief answer, just because
okay,
we
the
are
growing
up
up in
against
Ireland
it
has been
with time.
fantastic in terms of unpacking how those early educational and home learning environments impact on a whole range of later educational outcomes. It's been fantastic and really understanding the processes of play and how best to address those. And it is like things like homeschool community liaison. It's bringing parents into the school context, engaging with them, providing home learning environments, resources like books, library access, and all of those sorts of things. So yeah, there are critical issues early on in the educational process. If we address them, it improves life chances enormously. Yeah.
Very, very, very briefly, if mothers have higher levels of educational attainment and they're more likely to then be in the labour force, there's also a relationship between your grandparents looking after you and you then doing better in school and things like that, and if your parents are working doing better in school. So
Thank you so much. Thank you.
Karen. David, you're next.
Thank you very much, Chair. First of all, I want to get out of the way. It's been said in this committee before, you referred to it yourself. I think the list was unhelpful. I think we had of schools related to the RAISE project. I think we should all be able to, Pat may have found it useful in some ways, but I think generally we can say that being published was not conducive to or helpful to the programme, and I think departmental officials sat before us and agreed with that.
The department must have been confused themselves.
Well,
when they put it out.
Well, certainly, I think it shouldn't have went out. I'm happy to say that myself. It was misleading, and while I'm a defender of academic selection of our grammar schools and the work that they do, I do have some sympathy with the idea that schools doing the heavy lifting really need to be resourced appropriately for that, and I see that within secondary schools that are doing that within my own area. The only thing I would say is that some of those issues that they're facing, or at least the scale of them, are relatively recent, sort of have arrived on us fairly recently in terms of the waves of new communities, the rise in send pupils without having had the data from health and so on. So it's a challenge I think we're all, and I think everybody recognises it's challenges, but that we're all facing now in an imperfect situation, but that I think funding does need to recognise that going forward personally. I'm interested actually in going back probably to the discussion you were having around RAISE and understanding. I think there's probably, I think the answer to this probably is there isn't a perfect way, but I was formerly, as Danny would know, a representative for Liston Shara, DEA in Belfast City Council. I was constantly frustrated by what we call our neighbourhood renewal areas, because there was areas in my constituency fell outside those, but I felt were being punished because of relative affluence around them. I think that's some of the issues that you're talking about on a rural basis as well. I can think of an area in East Belfast where a community association on the Beersbridge Road, which I don't think anybody would argue isn't a sort of area that needs support in that way, falls metres outside the neighbourhood renewal area, constantly lose out in funding because of that. What way, is there any way you think we can improve the model that we do for education, but not just in education, across the board, to make sure that those pockets of deprivation across the country are recognised, and those people who live in those areas who are not financially well off or from affluence are not punished because of the relative affluence of those around them?
Yeah, I think it's a very interesting question, and there's been work done. Belfast is actually, and hopefully I remember this right, Belfast is actually, and the North more broadly, is unique in that other places the sort of deprivation does, where you live, it works on a spectrum in terms of the more affluent areas are further from the more deprived areas, and you can nearly see it as you move between them. Here, and I think some sort of economic history paper, it's actually because of sort of the way industry was that we have some of the most deprived and the most affluent are neighbouring areas, and it can cause problems. To be honest, super output areas are quite small. I don't think there's any perfect way of doing it, bar we do start looking at households and things, and that's just not feasible with data and with the dynamics and a whole lot of reasons, but there it very much is another specific Northern Ireland problem. So it's not even a case of maybe being able to look to other countries even to see what's happened, because they don't have that happen in the same way.
Yeah, no, I appreciate that. I think that I didn't expect a perfect answer to that, and I think, to be honest, I think that's why I probably welcome sometimes that there's a different approach to different programs, because sometimes you end up with programs, if they're all using the same metric, the same criteria, they constantly hit the same people, and those people who are left out get left out all of the time. So I think there's some logic in that personally. I also think, like, I'll obviously disagree on academic selection, and we can do that all day, but I think what we might be able to agree on is that actually that discussion and the dominance of that discussion, I think, hides a wealth of sins in terms of some of the underlying issues as well that we can deal with, and we might actually be able to agree on, rather than those totemic political issues. But that's more comment than question. And thanks very much, Chair, and thanks for your answers. Much appreciated.
David? Peter, have you as last indication given time? I'm not seeing any others, so I will take that as last indication.
Outstanding, Chair. Thank you so much for your attendance and evidence today. I have quoted ASRI on several occasions, probably at this committee. Actually, your research is really good, and I've really enjoyed reading through some other reports that you've done. I want to just start with early educational development and the relationship with sort of social class. It's one of the bits of your evidence. There's a study that I think it was Victoria State did, and they found that if you read to children from 0 to 4, by the time they get to P1, they'll actually have cognitive ability of a P2. That's the impact of reading every day. Would you accept that the battle is not actually, having a book is not particularly challenging, because books are very, very cheap these days, and reading material, even for kids, and as far as I'm aware, the Department of Education has book trusts, so all newborns in Northern Ireland get books. Would you accept that the battle around this sort of area is more getting parents reading to children? It's not, it's not a social class barrier in terms of the economics of it, because some of the that one intervention clearly demonstrates that actually kids can massively excel in school if they're read to every day, and that barrier of reading them every day is not necessarily an economic one. Would you accept that? Or you're maybe getting ready to shake your head there. And do you want to come back to me on? I'd be interested in your thoughts around that.
Selena was looking to come in, but it's again.
Oh, okay, sorry. It's difficult because of the screens.
Selena is probably the expert. I will say what I do know. I agree and I disagree. I think if you're we know what's happening with poverty. We know what's happening in here. There's people struggling. You might have all the books in the world sitting in the corner. One of my sisters has 3 children. One has 4. Getting home from work and doing dinner and bath time and trying to start reading is very difficult.
It's like, do you live in our house? Because we have similar problems.
And I think there's maybe more nuances attached to the economics of it. Yeah. I try not to be a scary economist that just says, you should do this or that. There's also a study which says the number of books even has an impact on children. So maybe the parents that are read then buy more books. But I just think it's very nuanced. But Selena will know the expertise in the area.
No, you're spot on, Anne. Access to books is important. And the number of books, absolutely, time and time again, every study we do, you put in the number of books in the home and it predicts all sorts of things internationally. So it is important. Library access is obviously another big thing. Countries that do library access, community access to libraries very, very well is another big area. But I think the role is really for preschools and primary schools to kind of make parents aware of those kinds of links and that importance of that time, that reading time with school, with their child. So I think there's an awareness piece for sure, and the preschools particularly have an important role here. Obviously, primary schools as well. Just to note that study that we did cite at the beginning of Anne's presentation did show that boys don't read nearly as much as girls. So there's a big gender issue here that we definitely have to grapple with. So that's another issue. That's an aside. It's not socioeconomic, but it's disadvantaged boys particularly who aren't reading. We can't ignore screen time and technology as well. So obviously that is impacting too on engagement of reading for pleasure. And we know from growing up in Ireland, so we compared the 2 cohorts, one born in 1998, the other born in 2008, the incidence of reading for leisure all through primary has declined dramatically over time. Part of it is to do with screen time and all of the activities around technology and mobile phones, but it is also to do with just a shift away from reading for pleasure. And that's something that we really do need to grapple with right across Europe. I think it's an issue. That's all I'll say on that. Yeah.
Thank you. I'm just gonna come back to raise, and I have the indicators because Anne, you've done some work on this. It'd be a shame if you did all that work and we didn't ask you a couple of questions on it. So
I'm going to ask for one question, Peter. Time is
Chair, I want my 5 minutes here. I want my 5 minutes.
Oh no, and you will.
You've got me to stopwatch. I'm going to stopwatch everyone in this committee, and we're recording the times now. Okay, so like, for example, would you accept that in terms of a child-centered approach, that indicators such as free school meals entitlement incorporated with income deprivation measures, health deprivation measures, and also GCSEs, and you made the case about what the problem with that was. But surely, if we're going to target outside maybe the traditional areas, surely having multiple factors that better target these children wherever they live and whatever school they go to, it's just the child who you're trying to support with RAISE. Having multiple measures in place to target the funding surely is actually better than having one measure, which is free school meals, which you accepted was we all probably would accept is a little bit blunt in terms of measuring where the funding should be targeted. Would you accept that, Anne?
I think I'd need more information on where, free school meals is every year. Mm-hmm. It can change quite a bit. It's that to me is the benefits of it. And also, honestly, as a researcher, see if things and data stayed the same, our life would be significantly easier. That would be my concern. I don't think it's a terrible idea. And as you said, in terms of the people who maybe are left out by other measures, but then also if other interventions are targeted towards you, and then I just would wonder why there's a change, to be honest. And I think free school meals is there. It's every year. It's comparable. It's consistent. And if that sort of data is available, they will all correlate. And all of them things, health, income, disability. If you look at the Northern Ireland Multiple Deprivation Measure and throw out access to services, it's entirely correlated across the board. So that would be my take on it.
And if you use FSME, and if the results from that FSME data said just put it all in X and Y to, let's call them place-based areas, okay, to large maybe population centres, do you think that's a good use of the money available? Or would you accept that there are other smaller pockets? You mentioned super output areas, we know about the NISRA fact. Would you accept that there are other smaller areas of deprivation and need in Northern Ireland, which sometimes don't get the same funding as perhaps area X or Y?
I think some of this was covered in responses to the Deputy Chair, so just a very brief response and then we'll close that.
Yeah, so I think I covered a lot of that when I answered Pat's. I think X and Y probably are Belfast and Derry.
Couldn't possibly comment.
But I do think all of them measures, as I said, correlate. They probably don't get at rural deprivation very well. Mm-hmm. I think if we are interested in regional balancing, which the economy is doing a lot of work on, and I do think it's something to consider. Mid-Ulster is the second most productive government district in the north. I didn't know about that coming from it till years into my PhD. I think there's a need for a spread because there's a lot of deprivation across the country and in rural areas. But it's a political decision, and it's in terms of where you're putting that money, and that's not for us to comment on.
Just to add very briefly to that, so the debt measure, is a multidimensional, the HP index. It's 10 indicators. It's very rich and complex. But the OECD, when they did their review of debt, said it wasn't sufficiently complex. And so they identified that there weren't measures relating to immigrant or ethnic minority background, and there weren't sufficient measures relating to mental health difficulties within a school context. So they were arguing for the need for more nuance in the measurement of difficulty and need in schools. So just to throw that in there.
Very useful. Thank you, Selena.
Yeah.
Thank you very very much. That's great. I think it's clear the level of interest in committee on all of these issues, and apologies if we haven't been able to get round everybody today given time. But thank you both for your time today and for your presentation and going through all of the questions, and thank you for doing your homework as well.
No, thank you. I'm very happy to follow up on anything that comes up down the line, to reach out to us or some of the other researchers at the Institute.
Yeah, well, I think there were a couple of things in terms of maybe some follow-up material. If you were able to share those with the committee, that would be great. So thank you very much.
Thank you.
Thank you.
Okay, so while Dr. Devlin just makes her way out, we'll close that section off. From my perspective, there were maybe 2 or 3 different bits of research material that I think there was an undertaking to share. So unless there's anything else that anybody wants to highlight
from that one, I would if the provision of the nuance around DASH stats could be shared with the committee, I think that would be. I didn't realise that it was quite so nuanced with 10 items. So if we could get how DASH is allocated and the measures.
Personally, the HP, are we in closed session? Are we online?
We're still in open session here. Yeah, we are.
The HP deprivation index, I don't think is as good as the Northern Ireland multiple deprivation measure. There's a lot more goes into the measure in the north, in terms of coming then to one figure, which essentially is what the deprivation index does. But we work with it quite a bit, so I'm happy to send over information on it.
Just wondering, Selena sort of said in terms.
We don't have time to.
No, it's okay. All I was wanting was
if we can get follow-up material on that, we can pick
it
up at an appropriate point. We really are beaten on time, unfortunately. So
there's very little on health and stuff in the measure in the south.
Brilliant, thank you.
So on that basis, we will have to move to item 9 on the agenda. So that is correspondence. Thank you very much.
There has been an approach to the DASH officials in the south to come as well, and we just haven't been able to arrange it yet. So they will come and set their platform, I hope, with the DE officials as well alongside.
That's good to know. That's great. So item 9 is correspondence. I'd refer members to pages 235 to 353, where we have 15 items of correspondence, and we have a summary note at page 235. So I will, as the usual approach, go through any items that require an action. Otherwise, it'll be as per the note at 9.1, unless members want to raise anything else. So item 9.2 on page 237. It's correspondence from an individual who has raised some specific issues around safeguarding in a Northern Ireland school. I would propose that we briefly take this matter in closed session due to the sensitive nature of the issue, if members are agreed. Are we agreed? So if we could just go into closed session.
Committee Room 29. Sound. Committee Room 29. Sound. Committee Room 29. Sound. Committee Room 29. Sound.